How's it going, Lynn?
Good.
Hi, everybody.
Chad is not.
Is CNET doing the meeting tonight?
They are connected, yes.
Okay.
Deirdre goes from the bike to outer space.
That's how fast I bike. I cut 2 minutes off my time this weekend, Laurel. The Skaz background. There.
Was it from Randy or Nabil?
Randy takes care of me.
I think Amber's.
Background then.
Email to find that.
Thank you. So everybody. I did. Hey.
No.
Okay. Do we have, looking to see if we have all board members here yet? It'd be helpful if I could get everybody on the board on one page, but there's not a way to do that, is there?
A good function.
It
Up
looks
at the
like
top
we're
of the screen, there's an option to choose gallery view in the top right-hand corner of the screen.
Do have gallery view on. Yeah.
Oh, you just have 2 pages.
Yes. Mhm.
I see.
Okay. Okay, it looks like we have everyone here. So I will go ahead and call to order the August 10th, 2020 regular board meeting of the State College Area School District Board of Directors. If you could all please join us in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. Sorry, I'm referring back to my minutes. At this time, I'd like to call on the board secretary for a roll call of board members.
Dr. Bader,
Yes, here.
Ms. Patel,
Here.
Ms. Brandt,
Here.
Ms. Concepcion,
Here.
Dr. Duffy,
Here.
Mr. Fozard,
Here.
Mr. Hutchinson,
Here.
Mr. Leos,
Here.
Ms. Zidney.
Here.
Okay. I'd like to welcome everyone who's here with us this evening, including everyone who is a guest viewing from home. I'd like to, announce, I think the board has not had an executive session since the last board meeting. And board members with an agenda before you, do you have any changes to the agenda as presented? Okay. All right. Seeing none, we'll move on. Dr. O'Donnell, would you like to read a few housekeeping items regarding our format on Zoom?
Sure. As a result of COVID-19, this will be a virtual Zoom webinar. Nick Zepp will serve as host of tonight's virtual meeting. The IT help desk is available during the meeting. If community members encounter technical difficulties at 814-231-7743. A few notes for meeting participants. As I see, we have a good number this evening. Welcome. When a board member or community members want to make a comment or ask a question, please use the raise hand feature in the Zoom program accessed under the participants tab. For the public participants, there are 2 parts of the meeting for participation: public comment, and if an action item is discussed further by the board. The host will lower hands and mute or unmute speakers as necessary to assist with the flow of the meeting. Pursuant to policy 3 of the board, at least 5 board members shall be present in the boardroom, 4 of whom must be physically present, with a 5th or an additional member or members able to participate remotely. As a result of the pandemic, all board members are participating remotely. Policy 9 provides that where discretion is directly and or by implication granted to the board may depart from policy. Given the extraordinary times and circumstances that we find ourselves in, the board is choosing to exercise its discretion and depart from policy 3's requirement of at least 4 board members being physically present. Obviously, this technical tool allows many people from the community to also join us. The board will continue to monitor the situation and make decisions on a case-by-case basis, continue or not, with meetings in this manner. The board will return to strict adherence of policy 3 as soon as possible. Thank you.
Thank you, Dr. O'Donnell. At this time on the agenda, we have time for communications. Is there a superintendent's update?
Yes, what we'd like to do on the front end here is highlight the safety plan update. We do have 3 members of our safety team, health and safety planning team with us who've been gracious to participate all along through the summer months with us. And we had a conversation with them last week in your work session. We'd like to revisit that and allow you an opportunity to ask additional questions. So that's how we would like to begin the meeting and then move along. So, you know, my comments on the front end here, I think, you know, obviously this is an ever evolving situation. Things have changed and continue to change. Through it all, I think I just want everyone to understand how seriously we take our responsibilities of working through something that we've never worked through in our careers. And we've asked some people with a lot more expertise to weigh in and help us out. And tonight, I hope, you know, the board will walk away with some questions for our team if we're unable to answer them, that we can work on before your work session on Thursday. Recently, the state announced it will not be involved with making decisions regarding local school districts. Then today, we received midday some guidelines for school boards on how to make those decisions. So we do expect to discuss those with you this evening and field some questions, as well as have our safety team weigh in on those. Our board does have to make decisions as per the Department of Education regarding our safety plan and approving the updates, as well to the plan, as well as the board has to approve an emergency instructional time summary, which is on this agenda this evening. And in essence, that has our 3 different options that we provided to families. So those are very important approvals. Obviously, what we know now is different than what we knew when we started this in June. So with that said, our goal is to help the board have more understanding regarding the safety plan, regarding the virus. At this point, I think I'll turn it over to Jean and have Jean share an update regarding the plan. We'll focus on the questions that are geared to the safety team members, and then we'll transition to the questions from board members that are more geared toward our administrative team. So there's a number of questions that I know board members want to ask. Some of them were submitted in writing, but we'll ask board members to raise their hand and ask their questions of the safety team members. So thank you, Jean.
Sure, thank you. So I'm going to do the quick summary that's going to be in the information discussion section now instead of later. And so I just want to kind of give you a brief overview. There were changes made on July 16th that required us to make some changes to our plan. And again, there were changes made today that will require us to meet again later this week and next week to make some revisions again. So I'm going to go up the most recent, or the changes that were made July 16th. And some of those were, they changed all social distancing language to physical distancing. They changed the number of students using the playground. They want that to be limited. The number of students in a locker room, they're estimating about 5 to 10 at a time. Staff and students, the next 3 are related to actual being exposed and not being exposed, and how we need to manage that. So I'm going to read that verbatim so that we're clear on what that is. So staff and students with fever or symptoms that may be associated with COVID-19 and no known direct exposure to a person with COVID-19 may return to school when they are asymptomatic and have been fever-free for at least 24 hours without the use of fever-reducing medicine, or have confirmation of an alternative diagnosis from a healthcare provider that explains the COVID-19-like symptoms. If a student or faculty member had a negative COVID test and were not in close contact with the case, he or she can return to school once there is no fever without the use of medication for 24 hours and no other symptoms. A student or staff member who is quarantined following close contact with the case may not return to school until cleared to do so by the Department of Health or a constituent from them. A negative test obtained prior to the end of the quarantine does not clear an individual for return. The entire quarantine period must be completed. And they also provided us with a symptoms checklist. And so this is more for conversations with the nurses when sending home, to have with the families and looking at if the nurses were really having a difficult time differentiating between how do we send home a child whom we know has allergies, but those allergy-like symptoms are on this list. So what the state did is they divided a two list process. So you need one of the symptoms from the one list, which would be fever of 100.4 or higher, cough, shortness of breath, or difficulty breathing. And you would need 2 symptoms of the other list, which includes sore throat, runny nose, congestion, chills, new lack of smell or taste, muscle pain, nausea or vomiting, headache, and diarrhea. And again, this is for the nurses to say, these would be something that we would need you to quarantine for 10 days if you fall into any of these symptoms. These are also on the list that we'll be sending home with families. And anything on this list, they need to stay home. So there's not going to be a 1 or 2 prong approach with families. It's just any of the symptoms need to stay home. So in addition to that, we're also digging deeper into our contact tracing processes. And we did receive some information from close contact for the Department of Health, and they've been helping us with some information. So you can see the attachments there, some things we're considering. We have also received a contact at Penn State in the doctoral program, medical related, that are ready to help us with some of that contact tracing. So we're looking into putting a team together there that's going to help us with students and staff in processing that, because that's been something that we've been very concerned about the time it'll take to actually move forward with the contact tracing process. That being said, I'm going to go ahead and introduce our guests with us tonight, and then allow them to do a brief introduction of themselves and where they stand in their field with this information and their role in the committee. And then we'll take some questions from you. So we have Dr. Maciek Boni, who's an epidemiologist at Penn State University. We have Dr. Joy Draus, who's a pediatrician from Geisinger. And we have Dr. Allison Huggins, who's a pediatrician from Mount Nittany Physicians Group and also our district physician. So I will turn it over to Maciek first, and then we'll go to Joy, and then to Allison Huggins.
Hi, everyone. So my name is Maciek Boni, and just to give a short introduction, I'm an associate professor of biology at Penn State Center for Infectious Disease Dynamics. Obviously, epidemiology is my field, which is one of the reasons I'm helping out here. And I just wanted to take a few minutes to give an introduction to some criteria that we'll be discussing this week about closing and later obviously reopening schools in the event that there is an upsurge of cases or something else that we consider risky. So essentially we've divided the potential risk into a couple categories. I'll go over those now. So the first one is whether we'll be looking at center county based levels of disease transmission or school-based levels of disease transmission. So the center county levels are going to be readily available to us from the Pennsylvania Department of Health, and the school-based ones may be a little bit harder to come by, but of course they are the more specific ones that we would want to pay attention to. So later this week, we'll be discussing the center county levels. So these will be percentage of positive cases, the absolute number of cases that we see in the community, and we'll also be considering the guidelines that Bob mentioned were sent to us today from the Department of Health or the Department of Education, which outlined the thresholds at which we would consider high or low risk, or the points at which we would decide to close schools. The school-based thresholds are the ones that we would want to follow, and if things go well, we may be able to follow these. And these, again, we have divided into two categories. So in the fall, we'll either be in a situation where test turnaround is fast, or where test turnaround is slow and we won't be able to make use of the tests. So if test turnaround is prompt and we can get tests back and we can get the information on positive and negative tests back from students in, say, a day or two, then we'll probably just use something straightforward like just a number of students that have tested positive in a given week in one of the schools. And then if the test turnaround is slow, basically we won't be able to use it for anything meaningful like a school closure threshold. So later this week, we are going to discuss what types of symptoms criteria. So the tier 1 and the tier 2 symptoms that Jean just mentioned, that would be indicative of COVID infections inside the schools. So as Bob mentioned, these are changing situations. We will come up with the best set of criteria we can this week, and we will just keep paying attention to guidance from the Department of Health and Education to see if those will need to be changed later or before the school year starts.
Thank you, Maciek.
Thank you.
Joy?
Joy, would you be able to unmute yourself? Sorry.
So sorry. Tech chat here a little bit. So my name is Joy Drass. I am the lead pediatrician at Geisinger at the Graveswoods practice here in State College. I take my role on this committee to be looking at the health of children as a whole and weighing sort of the risks of being in school versus the benefits and the risks of not being in school. And it's been a little alarming to us as pediatricians to see some of what I'm calling the COVID collateral damage that we've started to see this summer. Anxiety and depression in both our adolescent population and then also even in the younger kids is at an all-time high. Alcohol and drug use seems increased from baseline or pre-COVID levels. Many of our patients have had weight gain on the growth curves as we've done checkups this summer. And unfortunately, we've seen some cases of pretty severe abuse. So I want to say thank you to our teachers. Education to our kids is extremely important. And teachers, I think we all learned in the spring how maybe undervalued our teachers are, as some of us were trying to homeschool our children. And I feel like our kids need you, and I tend to be an advocate for them to be in school if it is safe. We obviously want to do everything in our power to keep everyone safe. And I feel like we have a couple months of data from some other arenas now as things have been opened up over the summer, that if we use our good infection control practices, mask wearing, what I call almost, obsessive hand washing, and hand sanitizer use and those sorts of things. In medical offices, we have not seen increased rates of infection among staff. In daycares that have been open since late June or early July, we thankfully have not seen big surges or outbreaks in those centers. And so I'm pretty optimistic that some of the infection control measures that we've put in place are working to help mitigate disease. I also feel like here in Center County, our rates are never going to be lower than they are right now for the foreseeable future. COVID is not going away, so we kind of have to figure out how to navigate this new normal. Certainly, I know everyone is concerned as the college students come back. And I will admit, I think it's really difficult to predict what that's going to look like. But we do have at least a small window of time now to bring our kids and teachers back safely, and then be extremely diligent to case rates and follow up to see whether what we're doing is working or if we need to change gears.
Thanks, Joy. Allison?
Hi, I'm Allison Huggins. I'm a general pediatrician in State College. I 100% agree with everything that Joy has said. I do have 4 kids in the school district, kids at each school level. So this is a very important topic to me. And I've been a part of the development of the health and safety plan. And part of my role has been to help interpret CDC and AAP guidelines for mitigation strategies. As a pediatrician, I believe that in-person schooling is important for children's overall health and well-being. The AAP has stressed multiple times that in-person schooling helps with social and emotional skills, helps with guaranteeing healthy meals and exercise, and provides mental support and other services that kids may not otherwise receive. So, like I said, Joy has brought up very valid points, and I won't repeat everything, but that's kind of what I've been doing.
Thanks, Allison. Amber, I'll hand it over to you again.
Okay. So I'll turn it over to board members then for questions, rather than going through these questions later on during the information discussion period. I think it'll be helpful to do board member questions at this time that are particularly for our safety team members. And then we'll switch gears, I think, when we move to the information discussion item at the later on in the meeting. Some of the more operational questions that we might have for administrators, we can share that. But for now, let's try to keep questions to questions for the medical professionals on the team. And I'll start with Lori.
Thank you. And I don't know that we can thank the 3 of you enough for everything that you've been doing over the summer to help inform us about all of this. So thank you. After we met on Thursday for our work session, I happened upon an article from the Journal of the American Medical Association about the fact, about asymptomatic individuals shedding the virus at similar rates to those who are symptomatic. And I'm wondering, if there's validity to this, should that change anything that we're doing? Should that help us think about things differently? Because, without testing, if we're relying on symptoms as being a marker, and being asymptomatic is not something that is something that in fact will shed the virus at similar rates, then I'm just wondering if we should be thinking about that, or if you've heard about that, or how that filters into your thinking.
So, yeah, I think this question is for me. It is true that about 2/3 of infections in children are asymptomatic, and sometimes these are infections that are called subclinical, where they might present with 1 or 2 very mild symptoms that are either not noticed or not reported to a clinician or the health system. It's not very well known how infectious asymptomatic individuals are in relation when compared to symptomatic individuals. It should be less, simply because they're coughing less and they're excreting fewer droplets and less mucus. But in a scientific study, if you just make somebody cough into a cone and measure the amount of virus, it could be similar. So, I mean, the assumption we should go with is that it's similar and or probably less. But the other reality we have to just, work with is that there won't be a way to test everybody on a weekly basis to see if there's asymptomatic individuals who could be spreading. So if that option were open to us, if it were either affordable or logistically feasible, I'm sure that we would consider it. But I mean, currently, I don't think it's something that we have on the table.
Thank you.
Dan?
Yeah, thanks. Thanks, Amber. Quick question, probably from Maciek. Good to see you again, by the way. Thanks for helping out. Thanks to Allison, too, and Joy for your assistance with this effort. This is a question that it kind of, in some respects, is on the education side, but it also, I think, may have meaning on the epidemiological side or the mitigation side of this. One of the things we do in terms of our work with kids is we really have in the last 15 years brought more attention to using evidence-based practices. So if we have students who are behind, for example, in reading, when we are working with them individually, we try to rely on measures and on strategies that have a known effect, and when we introduce them, we evaluate those strategies for the extent to which they align or match the original research basis for them. We describe this as fidelity or treatment reliability. And in a similar situation here, we're using mitigation strategies, some of which have been shown to be more powerful than others. And I'm wondering, in all this, Maciek, whether you think, in terms of implementing the safety plan, there might be 2 or as many as 3, probably maybe 2 mitigation strategies that you want to evaluate in terms of their implementation. How consistently are we implementing those strategies to say that, in fact, we're fulfilling the expectations and requirements of the safety plan, from which we can expect to get control over infection? Is that something that sounds familiar, something in your field that you would do in terms of evaluating the compliance of individuals with some mitigation approaches?
Sure. I mean, I'll address 2 parts of this. I mean, one is compliance, and 2 is our chosen strategy working? So compliance is something that can be evaluated, whether it's done through a survey or a video monitor that looks at mask wearing, or checking to see how often people wash their hands. So monitoring for compliance and evaluating our own adherence to the measures that we've put in place, I think, is a good idea. I don't know if there's any benefit to evaluating multiple types of policies or mitigation strategies or adherence approaches, because inevitably we'd be comparing an approach where we had higher adherence to an approach where we had lower adherence. And I don't know if there's much point in evaluating the lower adherence point. I think we would know that it wouldn't work as well as the higher adherence point. So the message in this is that we really only get one shot at doing this right. I mean, either we'll be facing outbreaks in September or October, or we won't. And normally in a study design like this, to evaluate an approach to controlling an outbreak, you would have multiple options that included vaccines and therapeutics, and we have none of that. So the only thing we have on the table are these hygiene and distancing guidelines, and all the common sense practices from the last 6 months tell us that whatever is possible and affordable and feasible, all of the very regular, slightly inconvenient hygiene and distancing measures, we should implement those to the most extent that we can.
So, just a quick follow-up question. Could there conceivably, I'll mention this, this is maybe more to the safety team itself and Jean and others, whether we, in doing this, once a week, we will evaluate the compliance of a school and have some marker near the main office that indicates how well everybody's doing. And so if people need to, they could change their behavior in terms of, let's say, mask wearing or physical distancing or whatever. I mean, there might be a way for us to give feedback to the school that could be the basis for making adjustments, so that we can be confident that we're doing as much as we can under the circumstances to control the possible negative outcomes. That's basically it.
Yeah, I mean, I'm wondering if during the course of September and October, certain types of questions will come up. For example, an N95 mask is very uncomfortable to wear, and in certain classroom contexts, teachers have said that it's impossible to keep on. So if something like this comes up, then yes, we do need an evaluation, because it's better to have true compliance with some type of mask wearing than a compliance guideline of N95 mask usage that isn't followed. So these will likely come up, and then yes, I think Dan will head into a period where we evaluate what our options are in these cases.
Thanks very much.
Thank you. Gretchen?
Yeah, hi, thank you. Maciek, I had a question for you. So you had just said, if infections go up in September and October or not. And what I'm wondering is, in your professional opinion, knowing that the Penn State students are coming back into our area, do you think it likely or unlikely that the number of infections in September and October will go up? Thanks.
I do think it's likely that the number of infections in September and October will go up in the general population of State College, generally in Center County. The percentage of Pennsylvanians that has been infected is in the 6% range at this point. So that still means that the vast majority of people are susceptible. The virus, in unmitigated circumstances, spreads quite easily. And if there's 18-year-olds and 22-year-olds coming back from places where maybe they haven't been distancing or practicing hygiene guidelines as well as they should have, then yes, it's likely that we'll have a moderate to large number of imported cases. And among the university student population, is it likely that there will be outbreaks in the fall? Yes. I mean, this all depends on us. It depends on our own behavior and how we interact with each other, and that goes for the students as well. But my hunch is yes, and that means that by September we'll be evaluating this very closely. It's not a guarantee that this risk immediately impacts SCASD. It's probable, but it's not a guarantee.
Okay, thank you.
Thanks. Laurel?
Thanks. I realized I don't actually know what people mean by quarantine. So it's written everywhere. If you do this, it's quarantine. Can you describe what the expectation from your medical point of view is of what someone who's quarantined is doing or not doing?
Are you asking that of the pediatricians? Or me? Or
however it is that when they said, we think this is important for you guys to do under certain circumstances, what is it that they are expecting? Like, I think we figured out that mask wearing means wearing it above your nose and mouth. And at first people might have thought differently. So I'm trying to get what are we supposed to do?
So quarantine means stay home. It means have as little interaction with other people as possible. For adults within a home, trying to stay sort of in separate areas, if you can use separate bathroom, shower space, that sort of thing. We all know realistically it is hard to quarantine from your own family, but it means that kids should not be going to school. They should not be going to the park. You should try to have groceries delivered if possible. It is not pleasure trips to Target, those sorts of things. It is trying to stay home as absolutely much as possible during that time period.
And would it apply to, like, if one of the things is that someone should quarantine, does that mean if there are siblings or a teacher and a student in a school who are in the same family, they should all do it if one is doing it?
So household contacts are considered close or high risk contacts. And yes, if there is a positive case in the house, the whole family should quarantine. The issue of how much of a classroom is close contact, I think, is one that's been sort of debated amongst this group. Per CDC guidelines, a high-risk contact is someone within less than 6 feet without a mask for more than 15 minutes, so for a prolonged period of time.
Thank you.
And I'll just add, in case for the listeners out there, that quarantine is used for individuals who have not been confirmed to be infected. It's used for individuals that have been exposed and are suspected of maybe being infected. And isolation is used for individuals who are confirmed infections.
That may have just clarified where I kept getting confused about what we're wanting people to do.
A confirmed infected person should isolate, and a person who was exposed and maybe at risk should quarantine.
And the difference is?
Well, the action is the same. You separate yourself from all human contact as much as you can. But a health authority like the Pennsylvania Department of Health wants to know how many people are in isolation and how many people are in quarantine, because the isolated cases are confirmed positives and the quarantine cases are not.
Other board member questions? We have a document of questions. If anyone wants to read any of the questions that you had inputted into the document, please feel free to do so. Dan?
I have a quick question in relation to the update from Allison and Joy. Well, I'm a board member now. I previously was employed and I worked as a school psychologist for lots of years, worked closely with counselors, and we were very attentive, and the counselors especially were very responsible for attending to possible abuse. And the events and the circumstances and situations that you're describing regarding children who have suffered this, has this been neglect, or has it been physical abuse that you might have seen an uptick in? That for either Allison or Joy.
So from my perspective, oh, you want to go, Joe? Sorry.
Go ahead.
All right. No, I was just going to say, I haven't seen, I've seen cases of kids abusing substances, things like that. I have not seen specific cases of child abuse personally. Have I heard of, but yeah, so that I would just like to point that out. So if you want to say something, Joy.
We have definitely seen some cases of actual physical abuse in the office.
Yeah.
Neglect is a little harder sometimes to tease out. In both cases, you know, kids have to be in front of people who are non-family members, and that's happening less and less right now. Do I worry about neglect? Absolutely. Do I worry about food insecurity? Absolutely. It just, some of those things are not coming into our offices. And they're not getting in front of you and things like that.
Thank you. I was just curious about the meanings of some of the terms that were used. Thank you. It's helpful for Jean and her staff to be alert to this. Thank you.
And I think it's really important for us to be mindful of these issues going forward. If we are going to be reopening schools and we don't know how long we will be able to have them open, and there's a likelihood we have to be remote at some point, then there really has to be, some robust planning. And I know Jean's office has been, really considering how we can best support families if we do end up in a remote option, and whether all students would be remote in certain cases or not, and how we can best support families. So being, to the extent that we're really aware of those risks, I think is really important. Laurel?
Thanks. I'm not sure where this falls, but I'm wondering, we've all heard about hand washing. Beyond hand washing, what things are you thinking are the most important and wearing a face mask for people to be doing, say, in a school? Should they be carrying around a wipe, and every time they touch a door, they should themselves? So I'm talking about not the broad cleaning, but as individuals, what we might be doing to protect, I guess, more the people around us. Can you talk a little about that?
So the way people become infected is to get virus particles on mucous membranes. So inside your nose, inside your mouth, on your eyes. So if on an individual basis, people can be really good and diligent about hand sanitizer or hand washing before they touch food that they're going to put in their mouth, or before touching their nose, mouth, or eyes, that's probably the highest kind of rate of viral load, more so than wiping the doorknob right after you touched it. The data seem to evolve over time on how long this virus will live on surfaces, but you kind of have to think about a total viral load for infectivity. So I sneeze, I touch the doorknob, the student right behind me touches the doorknob right after me, and then rubs his eye. That's a higher viral load than something that sat for 2 hours, or I touched the door, somebody after me touched the door, who touched a cup, who the next student touched. It's like every degree of exposure beyond that initial contact. Obviously, the worst is, the student next to me in line, or I'm looking in a child's face to do a strep swab and they cough while I am nose to nose with them. And then it diffuses from that point on, if that makes sense.
Gretchen?
Yeah, thanks. Since it was just said that it's possible to become infected when virus particles enter the mucous membranes of the eyes, and I have also read articles about recommendations for goggles or some type of shield for the eyes. I know that in our safety plan, it requires masks, but I haven't seen anything requiring eye protection. But since we just were told that the virus particles can enter in the mucous membranes of the eyes, I'm wondering is why that might be that that's not in the safety plan. Thanks.
Well, if your students have masks, that virus particle shouldn't really be able to get into a student's eyes very well. We really think about the masks in those times where we are nose to nose with another person and they can directly spit or cough or sneeze kind of into those mucous membranes. Otherwise, you have to touch your own eyes or have someone touch your eye, which hopefully is not happening, but I realize sometimes kids can be kids. But eye protection, goggles and masks are really for sort of what's considered splash protection or direct inoculation if another person were to sneeze directly into your face. You do have to rely on the individual not to frequently touch their eyes if they've not washed their hands.
So is it possible to become infected through the eyes through aerosol?
Yes, but this is droplet spread, not aerosolized spread. The thoughts on when the virus becomes aerosolized are extremely minimal at this point, and it's things like intubation or aerosolized generating procedures, which would not be happening in a school environment.
And I just wanted to point out, we had talked about face shields in the past at prior meetings. And from a practical standpoint, if a child's wearing a mask and they have a face shield, their face shield is going to fog up. They're going to be touching their face. They're going to be wiping their face shield. That it almost seemed like it would expose more because of cleaning the face shield and touching their face and having something else there that they would be maybe messing around with, essentially.
Do glasses provide any protection with the virus particles entering eyes?
Sure, as long as you're not reaching under the glasses and rubbing your eyes and that sort of thing. If everyone's wearing a mask, the chances of issues with eye contamination are extremely low.
And I think that's the whole goal of the goal of having kids space 6 feet, wearing a mask to decrease the need of some of these measures that are a little bit higher intensity, if that makes sense.
So in terms of the question of the virus being spread by aerosol, I know there's been a lot of discussion about what that means, and that we don't think it means when we discuss it being potentially an aerosol spread virus, that it's not the same thing as measles, where it hangs in the air for 12 hours and can infect people significantly after someone has even left a room who has had it. The letters that have been written to the WHO by groups of scientists with concern about aerosol spread were, I think, based on some of these events related to the choir in Washington State, where many people were infected, where it seems like singing might be one of those activities that creates an aerosol spread. Maciek, I don't know if you could speak a little to where the state of the science is on aerosol and how that should inform our practices in any way that we may not have considered.
Sure. The scientists that study this, they break up the particles that you project out of your mouth when you speak or sing or cough. They break them up into different sizes, and they describe them based on how long they can be aerosolized for, 30 minutes, 1 hour, or 12 hours. And it's true that it doesn't seem like you can infect somebody who enters a room 12 hours after you've been there. But there's both some large droplet spread, some small droplet spread, some aerosolization. So even though the science is changing, none of it's really actionable at this point. There's no infection control experts I know that would say that there's definitely no airborne transmission, so there's no point in wearing masks, or the other direction, that there's definitely no droplet transmission, so you can touch all the surfaces you want without washing your hands. I think both hand hygiene and masks are the appropriate route given the state of the science.
Thank you. Other board member questions? I had one of the questions that I had put in the document where I was collecting questions. It's really one of the concerns we've heard over and over from the community is related to the data that we have now on infections in Center County and how useful that is in being able to move forward with reopening school, because of the fact that our population here is going to increase by about 40,000 Penn State students from all over the state and the country the same week that we're looking to reopen schools. And so it puts us in a bit of a different situation than many districts that are able to look at their local infection numbers and test positivity rates to make informed decisions, because the population we have now, from which we're getting those numbers, is not the same population that we will have come the last week in August. So I don't know if this is really a question, but I think it's because it's a concern that's been raised repeatedly by people in the community. It's just something that I think we need to continue thinking about in terms of how we're building our decision making going forward. And I know Maciek is looking at, what are some of the best benchmarks or metrics that we should be considering as we're making decisions. So. Laurel?
Yeah, thanks. It's a little awkward, but I'm wondering, again, I wanted to repeat what others have said about thanking you very much for helping us with this effort and for the time you've put in and continue to put in. And I think we are at a real advantage because we have a range of people. We don't just have one person. We've got people coming from different perspectives, different specialties, different levels of experience. But with that, you're going to sometimes have disagreements. And so what I'm trying to understand as we work on the recommendations that we get is how much uniformity there is in, or maybe the way to put this is, what are the things that there was the greatest uniformity that across the board, you guys all said, absolutely 100%, this has to happen. Can you address that?
Masks, physical distancing, washing hands, sanitizing.
So even though we've heard from a couple of people who have said, oh, we don't need masks, from the medical experts advising us, it was pretty much absolutely, this is across the board, very strong agreement on.
Mm-hmm. I would say
Yes.
Joy.
Yes, agreed.
Mm-hmm.
It's very helpful to know because I think some people think, well, 50%, 52% said yes and 48% said no, so they put it in there. So it's very helpful to hear that and to know the things you feel most strongly about that we can do to protect our community and our students.
It really was never a question. It was, what can we do is the highest protection rate for everyone. What do we need to do? And there was not a, maybe we shouldn't. It was always, we have to do the best we can.
Yeah, I mean, I can add, Joy and Allison and I have been on a number of these phone calls, and I think all three of us understand that without a vaccine or without a therapeutic, in general, a respiratory disease outbreak is pretty difficult to control. So when you only have a small number of tools available to you, the distancing and the masks and frequent hand washing and face shields, you essentially want to implement or require as many of them as is feasible. So one of the ones that eventually was taken off the table was routine testing because it looks like it's too expensive and it doesn't look like tests would come back within a 7-day period or a much shorter period. But if routine testing were free and if the tests came back the next day, then I think all three of us would probably agree that we would require that as well.
Okay.
Sure. And the other thing that I say a lot is, kids will not wear their mask 100% of the time. They obviously have to take it off to eat. They're going to get to go outside. They probably need short mask breaks, that sort of thing. I actually think the 6-foot social distancing or physical distancing is probably harder for kids to maintain. It's just outside of our normal tendencies. We tend to like to stand 2 to 3 feet away from each other to have conversations and that sort of thing. So they will not stay 6 feet apart 100% of the time. Hopefully they will be doing one or the other nearly 100% of the time. And always washing their hands. I think teachers probably have a little more control of the 6 feet distancing from students to themselves than the ability to keep the kids apart. But obviously that's something that we'll want to keep an eye on.
And then for Laurel, I can repeat another part of a discussion that we had last week on this exact topic. That one of the paradoxes in public health is that if you've done a good job in implementing all these measures and if you've kept infections down, then you'll think that you're overreacting, but that's not true. What's happened is you've done exactly the right thing. to keep infections low. And now one of your challenges is maintaining all this momentum, keeping up your public health communication through teachers and the school board to students, just as you did before, going through 1 more month of high compliance with these measures, going through another month with high compliance to these measures. And, you know, that's how you get to Thanksgiving with low case numbers and with schools open.
I think we don't give ourselves enough credit because the case rates have stayed so low in Centre County that some of the things that we started back in March have made a difference. The safety measures at grocery stores, the safety measures everywhere you go, the mandatory mask recommendations are the things that have kept our case rate low. I think we all may not be coming from as many different places as the students that are going to be coming into Penn State, but many people have traveled outside of Centre County and come back over this time period, and many of the mitigation measures we have in place have kept us from having outbreaks. And I think we're all a little worried about the college students, but I think that there are some levels of us not giving them enough credit. I personally have an incoming freshman who is going to go live in the dorms, but she's pretty nervous about it, and she really wants to follow the rules and do what she can to help. None of those kids want the dorms shut down and to go home. So hopefully this is on the forefront of many of their minds as well. And Penn State just last week announced some of their testing practices and testing coming. They are either sending out or in process of sending out a very large volume of tests. Students coming from high-risk locations are required to have a test here in the next week before they come back to campus, and are supposed to quarantine for a week before they come. Obviously, positive results are going to be followed up. I will admit to you, I didn't get all the way through those recommendations. And some random testing, even from people not in high risk, this week and in the weeks to come.
Good. All right. Any further questions from board members? Jean, is there anything else that you wanted to review at this time?
No, not if we're going to follow up at discussion and information discussion at the end.
I think in information discussion, well, the questions that we have that are more operational, we can go through those then.
Yep.
Okay.
Thank you. I'll miss my friends then. Maybe I'll have you in text.
Thank you so much to Dr. Boney, Dr. Drost, Dr. Huggins. We really appreciate your time here. Thank you.
Thank you.
Good evening. Thanks.
Thank you.
Okay. I need to find the agenda tab again. Okay, so the next item is our legislative update. Lori and David, do you have a legislative update for us?
We have a meeting next week, so I don't have anything new to share. David might have some insights, though.
No, nothing to add, thanks.
Okay. Gretchen, the Council of Governments update?
Yeah, so the Council of Governments General Forum met last Monday night, and the Penn State representative, community liaison representative was also at that meeting, as she always is. And what was sort of the take-home message after an hour of discussion among community elected officials was that there's sort of the lens is that it's irresponsible of Penn State to open in regards to the high likelihood that local community infection rates will go up, and that Penn State is not being all that respectful to the community as a result of that decision. And this was my perception of the hour of discussion during that meeting. There were a couple of people, the representative from CBICC did not agree with that. Maybe one other person saying, well, the students are going to come here either way, whether Penn State opens or not. but amongst the majority of elected officials from the different townships, that was the general tone of that hour-long discussion. There were also some Penn State graduate students on that meeting, on that call, who also were communicating that they felt that Penn State was not being responsible to the graduate student population or the local community by opening. And there were some comments from local elected officials who were saying, well, if we want schools to open, our local school district and the surrounding districts in the county, then we would not want Penn State to open, because Penn State opening would be, because of the increase in cases that will likely happen, then schools might have to close because of that. And so what are our priorities? So there were a couple of comments about that as well. And there was also, that was the day after the 43 positive cases that came out in Center County. And so there was, the health official from the COG was communicating with Mount Nittany, trying to get information about the accuracy of that high sudden increase case number. And at the time, this was again last Monday, so a week ago tonight, he was told by his contact at Mount Nittany Medical Center that those tests, those 43 tests, were being retested to determine the accuracy, and that those results would come back in about 3 days. But I have not heard anything since then about what the answer was pertaining to the accuracy of those tests. They were, of course, trying to figure out why did that sudden increase happen? And again, I have heard nothing from, nothing's been communicated from COG to me about the answer to that question, or the answer to the reliability of those tests. And that is the COG update. Thanks.
Okay, thank you, Gretchen. Okay, so at this time we have time for public comment. We do have quite a few people joining us. It may be helpful if we limit public comment to about half an hour at this time, and continue with public comment at the end of the meeting. If we've reached that, if we have had more than half an hour of public comment. I would like to ask that attendees who would like to make a public comment use the raise hand function, and we'll be able to get you linked in so that you'll be able to make your comment. And if you could limit your comments to 3 minutes, that would be great. And I'll let you know when you've reached the 3-minute mark. So our first the first hand I saw raised was Julie Christie. If you would you may begin your remarks. Thank you. And you may have to unmute yourself. Julie Christie.
It does appear that Julie has lowered her hand.
Oh, lowered her hand. Okay. All right. Aaron Spade. Aaron, would you like to make some remarks? You would need to unmute.
Yes.
Yeah. Great. Thank you.
Thank you for allowing me to talk. I'd like to say that I'm a little upset that some weren't able to attend the district rally we had a couple days ago for to talk about illicit demands that the students had created to better for the next school year. But I would like to update you all on it, and I was wondering maybe if some of you could take notes, because I noticed it didn't look like some of you were taking notes when you were talking to each other. But here's the demands. I'd like that we make African American Studies a full year credit and a mandatory class, so that I'm no longer called the N-word by other white students. Include authentic Indigenous and cultural representation in history curriculums of all types of people. More funding for office and equity and inclusivity. Include more teachers of color, and have more intense bias training, or basically no racist anti-racist training, basically, for the faculty, equity and learning support for learning enrichment classes, and more reliance on the REACT team and more students of color in the student government, because right now it's just all white students. Thank you.
Thank you for your comments, Erin. Michelle Rodino?
Hi. Thanks again for all of your work, board. We parents really appreciate it. I just want to say, COVID is now the number 3, actually not quite, but I think inside of this week at this rate, it is very close to becoming the number 3 killer of Americans. And for the whole year. So let's not wait until, we see that number, and let's not wait till it's number 2 or number 1 to take aggressive preventative action. So what I would say, given that we have a small hospital, a small town, and a gigantic university that's going to be hosting these 40,000 students soon, it seems like it makes the most sense to open all remote and just go to that plan now rather than later. And if things go well, think about putting in place the plan we have now. And then secondly, at minimum, teachers need choice as to whether or not they teach in the classroom or remotely. We have that choice as parents, and it's time we extend that choice to teachers. Thank you.
Thank you, Michelle. Is anyone else who's here in attendance who would like to make a public comment? Michael Cox? If you could just unmute yourself.
Okay, here we go. Yes, I understand the concern about the COVID disease. I also really appreciate our doctors who were here. And I think we really need to take into strong account what they said about, number 1, the increase in abuse, the increase in suicide, and what most pediatricians have said, the need for students to be able to learn in person. I think we need to really consider that there is not going to be a perfect answer, and that while there may be some risks while the students come back, we really need to weigh those risks along with what our pediatricians said about the short-term risks of not being in school and the long-term risks that will happen and probably already have happened as a result of our students missing half a year and perhaps missing more. Some students respond better to the virtual setting than others. A lot of them do not. And I really want to make sure that we take that into consideration. And I think it's also very important that parents have a choice to be able to give their students the opportunity to go either virtual or public. And I think as a board, if you remove that choice, you're not doing the community any favors. We signed up, and I think it's important that we continue to have that choice. I also feel the same way toward public sports and fall sports. We've already made an investment of $13 million for the football stadium. Obviously, that investment that you made acknowledged the importance and the benefit of sports, and I certainly hope that you will give the students and the community the opportunity to reap those benefits and that very large expenditure of $13 million, which all of you approved. Thank you.
Thank you for your comments, Michael. Alana? And you'll have to hit the unmute button.
This is actually Alana and her mother, Leslie.
Hi, Leslie.
Hi there, Amber. Thank you all very much. We know this is a really stressful time, and we appreciate all the decision and the effort that's going in to listen to our concerns. And if the building and school has to remain open and cannot go remote, as one listener just suggested, by fall, I just was curious as to whether or not the district has discussed that hand sanitizer stations could be put in between the entrance of the building and the doors, so that as students come off the bus or arrive from the loop, they would be forced to use hand sanitizer before coming into the building. If that's at all possible. I didn't hear that in any of the discussion plans. And then my second concern is that, also as another caller just listed, it is really important. I know you don't normally comment on everybody's demands, but since the students were successful in hosting a rally at the Panorama building and the board members were sick and not able to come and receive the demands, they were received by Syria. But it would be really great to have the board acknowledge that they have received those demands and that they will respond in a timely manner to the students who spent their Saturday out on the fields doing so, lifting their voices courageously. And they had about 100 community members support them. So it would be good if it was on the record as you receiving them. And then I'm going to turn my last minute to Alana, who's here, who wanted to ask something.
Hi, I just wanted to raise another demand similar to Aaron, who also goes by Michaela, that we should have more equity in learning support and learning enrichment classes. I know a lot of us are interested in academics, and I think it'd be great to have more proactivity in the district and encouraging students of color and Black students in particular to challenge themselves in more classes, as well as encourage them and make sure all classroom environments are safe for them. Thank you.
Thank you, Leslie and Alana. Yeah, the board did receive the list of requests or demands that the students had who hosted the rally. I had written a letter back to the students. I think Dr. O'Donnell had scheduled a meeting with them. I'm certainly more than happy to meet with students anytime, over the next few weeks when we're able to schedule something. So thank you for your comments. And in regard to hand sanitizer, I think that some of those disinfecting and sanitizing practices will be in our safety plan. Okay. Christopher Kissel. And if you could unmute yourself.
Okay, can you hear me there? Hello?
Yes, we can hear you. Thank you.
Okay, well, thank you. First, I'd like to thank you, and I realize the difficulties of the situation and the time and effort and all the dedication you guys have endured, and try to guide our children through this experience. With that said, as a father with 2 children also in the district, and a spouse who's a teacher, 2 of which have autoimmune disorders, I noticed that the board members with the board meetings are virtual. The irony of this is not lost on me, as many of our teachers, staff, and custodians are in the same age demographic as the board members and professionals speaking this evening. So I was hoping you could speak to that. And also, one of the panel members said that the 6 feet physical distancing guideline cannot be ensured. Kind of find this disconcerting because I'm sending my children and my wife, into the district with provisions that, that you're going to follow the CDC guidelines. And for clarity and the sake of my wife and children, I'd like to know what the physical distancing guidelines will be, that they will be upheld, if that's possible.
Okay. Mr. Kissel, I think our district safety plan does indicate that we're using the 6 feet of physical distancing as a standard. I think that comment was in regard to perhaps like in passing, there may be instances when someone passes within 6 feet, but that within our schools, that's how it's being structured.
Amber, 6 feet's not on the buses though.
I'm not sure.
That's
Yeah,
correct.
it's not on the buses.
Okay.
And we can put questions on the buses when we get to the conversation about the plan as well.
Yeah, we can further review that during the information discussion then. Thank you for your comments, Mr. Kissel. Danny Dudas? And if you could just introduce yourself and where you're from in the district too.
Hi, can you hear me okay?
Yes, we can hear you. Thank you.
Okay, thank you so much. I'm sorry if you can hear my toddler in the background. My name's Danny. I emailed the board last week and I submitted a letter to the paper. I'm an alum. I graduated from State High in '04. I love this district and I wanted my children to go to this district. So I'm just really thoroughly disappointed with the way the remote plan has been amped up with tons of meetings, so much wonderful information, and then it just gets scrapped. And every person that I've talked to and things that I have read on the district's website have used the phrase, when we go remote, XYZ. And what I want to know is why we are even planning for that. Why are we wasting time and effort and putting teachers and children in danger, creating a scenario where we do have to go remote, instead of taking the effort all summer and creating an excellent remote plan and starting that way. And it also, I also very much noticed that this meeting is on Zoom. In 2 weeks, you're asking our children and teachers who are all your age and my age to get together in a room with more people than is in this board meeting and be with each other for 8 hours a day. So I think it's very ironic that this is how this Zoom meeting is being handled. And I really would like the board to reconsider how this school year is going to be started. Thank you.
Thank you, Ms. Dudas. The next public comment is from initials MP. If you could just introduce yourself and where you're from in the district, please.
My name is Michelle Perret, and my 2 children go to Ferguson Township. And I would just like to thank the school board for, I feel like, giving this community a wide variety of options, more than I think most school districts in the state are willing to do. And I would just like to echo a previous comment that I think we really need to hold in high regard the opinions and facts provided by the doctors who are on the call today. Everyone has an opinion, but none of us are nearly as educated as some of the members who spoke earlier today in the meeting. And just one other comment, I would like to say that one of my children, despite the tremendous effort of his teacher and us as well, he is not meant to learn remotely. That's not how his little brain works. And I'm just thankful for the opportunity that he gets to go in person in just a few weeks. Thank you.
Thank you for your comments. I see Douglas Glannert next with a hand up. And if you could unmute yourself, Mr. Glannert, and just introduce where you're from in the district.
Thank you very much for allowing me to speak. My name is Doug Glannert. I live in Patton Township, and I just have 2 comments. The first comment is, I took the time on that day that the students put the rally on, and I went there to watch, observe, witness, and see how organized students were. And I was impressed. The students were calm. They presented their thoughts in an extremely organized manner. They each spoke. They had a sound system set up. They had a small tent set up. They had refreshments set up. They were organized, and I was very pleased and somewhat proud that this is the future of our country there, represented by the people at the rally. I was very pleased with that. My second comment is, I know that board here is facing a very difficult time. I'm very concerned with what all is going on and taking place, not just in our little community, but the entire world. I think I heard that Maciek said we're at 6% right now, cases according to our population. I really don't want to see that number go up. And if it does, I have heard that the board is prepared to make the difficult decisions that will require them to do what is necessary to protect our children, our teachers, our staff, and our community. Thank you very much.
Thank you, Mr. Glannert. Thanks for your comments. Is anyone else who is here interested in making a public comment? Mr. Eggerer? And if you could unmute yourself, thank you.
Hi, can you hear me?
Yes, we can. Thanks.
Great. Thank you. My wife and I are State College residents. My wife is an alumni from State High. It's been a wonderful experience here. I wanted to thank both the board and the teachers for all of their commitment to providing students a diverse set of attendance opportunities. I know it's not everybody agrees, and there are people that want to live in an igloo and there are people that don't think it's real. But the majority of us are down the middle somewhere, and I believe you provided a lot of information and a lot of opportunities, and I'm very grateful for it. And I know our children are as well. I'm hoping that as you go forward, you apply the same efforts into providing safe choices for extracurricular activities to include sports. Organized activities are far more likely to provide a disciplined framework for interaction among students, which would lessen, in my opinion, the COVID disease spread, than by merely allowing students to exit after school and go out. They're going to meet somewhere. They're going to congregate. But I do think that there are a lot of things that go on in that extracurricular that are really, really great for kids. And I hope you don't overlook that going forward. And I hope you do put the same effort that you've done for providing choices for school attendance into those as well. And again, thank you very much for your time.
Thank you, Mr. Eggerer. Amy Schoen, Ms. Schoen, if you'd like to speak, if you could introduce yourself and where you're from in the district and unmute yourself. Thank you.
Can you hear me?
Yes, we can.
Great. Hi, my name is Amy Schoen, and I am from Ferguson Township. I have a senior at the high school, and I'd just like to say 2 points. I appreciate all the incredibly hard work that everybody has done in this, and I just would like to advocate for the kids in the career technology program. For example, like I said, I have a senior and he intends to become a mechanic, and it's going to be very hard to do that remotely. It's hard to work on a car from a Zoom meeting. So I would just like to advocate to keep that at least in an in-person setting, if that's at all possible. And the second thing is to add to the previous person's comment related to the importance of interscholastic sports. It is tremendously important for a lot of these kids to have the structure, the leadership, and everything they glean from it, not to mention this is 12 years in the making of hard work, and to have that taken would be very difficult for a lot of our kids. Thank you.
Thank you, Ms. Schoen. Would anyone else here like to make a public comment? Denise Cameron? And if you could just introduce yourself and where you live in the district. Thank you.
Sure. I'm Denise Cameron, and I'm with Ferguson, or live in Ferguson Township. And I just wanted to speak to on behalf of the not only sports, but all the clubs and all the extracurricular activities that the district offers. You know, if the students, we have some that are choosing remote, we have kids that are face-to-face, but at that secondary level, that face-to-face is an every other day program. And I know there'll be remote learning for them on the off days, but it's a lot of time for kids to be alone. And the school district is so big that for many of these students, their social contacts are made in the clubs and organizations that they're in and participate in. So I'm hoping and would also advocate that in a safe manner, that those sports and clubs and some activities can continue for these students. I have a son that participates in football. We've had the summer workouts and they really enjoy attending those workouts. It's very successful. I see the kids go in, they're masked up. I see them come out, they're masked up. And so we appreciate the summer workouts, and we're hoping that for the fall that there'll be some programs that can continue. Thank you.
Thank you, Ms. Cameron. Is anyone else here interested in making a comment? Okay. I'll wait just another moment. Okay. Then with that, I think that concludes our public comments. At this time, I would like a motion to approve the routine approvals as listed on the agenda.
Lazard, so moved.
Duffy, second.
Okay, that's been moved and seconded. Board members, questions regarding routine approvals. Lori?
Yes, I'm sorry about this. I have a question about the technology renewals contract. One of those renewals is for Huddle, the Huddle renewal for $10,650. And so my question is there a benefit to renewing now as opposed to postponing? I'm reluctant to renew something with that big of a price tag when we're not quite sure what athletics is going to look like just yet.
I can't speak completely accurately. However, I'm guessing that most of our licenses do renew at the very beginning of the school year, either over the summer, July or August, or at the beginning of September of the school year. So I'm assuming that that is why this is being brought forward at this time. Again, I don't know if Dr. Stout can speak a little bit more clearly than I can, but I understand that this is not only for the students while they are actually participating in sports, but it also helps them to communicate in their pre and post season, as well as the students pursue post-secondary athletic experiences as well.
Yeah, Lori, I do not have additional details on it right now, but I will check with our athletic department. But I agree with Randy. I'm sure it is an annual renewal. So, but we'll take a closer look at that.
Okay, because I guess is there a penalty for postponing the renewal? And if it's, and I guess if there could be more clarity about what benefits it provides if we don't have an athletic season. I understand that, if it helps students connect with post-secondary education somehow, that's a good argument. But I guess I looked on the website. I'm not really sure, other than what the website said about allowing for students to review their games and improve their athletic ability and their performance. But if we haven't made a decision about athletics, it's a lot of money to spend if we don't need it.
I wanted to mention I had the same question that Lori just asked. So Lori, thank you for asking that.
Laura, was your question on this item?
You're asking me?
Yeah, was your question on the same item?
Yes.
Okay.
I also had raised the question about Huddle, but there were a couple things on here, and one is that we have another $35,000 expense under technology. This is going to be for the elementary equipment now that we've made this change that we did. So it's similar to one we had previously for secondary. But again, these things are coming at us and we're sort of caught because we need to move on them, but we haven't been able to have a good discussion about them. They're just being presented. And I'm also interested in that one and whether delaying one more week would give us time to understand better what we're doing. The other one is the SmartBook Media, which appears to be significantly more expensive than the two items it's replacing were listed as previously based on our renewals the last couple of years.
So regarding the cameras, if this purchase is not approved tonight, then obviously that causes another delay in ordering and obtaining the cameras. And that would jeopardize our experience when we are in session. I can't speak to the other specific items and their increase. However, I do know that we've been going through various levels of evaluations of different softwares and resources. And even though something may be more costly, I would expect that there's a rationale, as we've done this several times.
I don't know if Justin wants to speak to any of those, any specific questions. The huddle piece, if board members propose to postpone it for a week, we'll be back next week. I do know it's used for helping students prepare film for post-secondary opportunities and to communicate out. But obviously, if we do not have a fall season, I would envision coaches and players still using it to develop those kinds of resources to communicate out, but from local experiences.
Good to know. Scott?
Yeah, on the Huddle side, I don't know this for a fact with Huddle, but many of these programs, you're paying for your access, as Bob and I think as Will had said, to the videos. So if you turn that off, you don't have that access. So all these historical videos over the years of somebody's high school career, they will lose access to. I don't know that for a fact, but many of these programs are built that way. That and that's the goal. They're tying you into a revenue stream for a product that you're going to use. So that would be the concern that I would have with turning it off. I don't know that delaying a week will affect that, because hopefully it's not expiring on August 11th. But my guess is that that's probably a big consideration of this.
I can jump in and speak to some of it. So the Huddle, they are using that outside of just the athletics program for helping the kids with their exercises and training. So even if we aren't having fall sports, I know that they're going to utilize that with the coaching staff and the students. And as Scott pointed out, not renewing it will likely, because what we do see a lot with these agreements, they'll increase the price if we go with a pause for a year. So the next year we renew, it'll come at an additional cost, because it's not a renewal. They'll treat it as a new contract. So just something as well to consider. And then Laurel, touching on the cameras, that is an additional cost. That's with the switch to synchronous learning at the elementary level. One thing to consider with that, Randy did touch on it. Most of that equipment is back ordered, and we're hearing that from other districts, other companies. Getting that equipment here has already been a struggle, just with getting it lined up here. So if we delay that, it is extremely unlikely that it would be here for the start of the school year. So just to have that in your mind as you guys are making this decision. And then the SmartBook media, I know that the librarians had been involved pretty heavily in that evaluation process to ensure that it was an improvement for the students and faculty with the resources.
Thank you. Jim?
Yeah, I was just going to echo the fact that what Justin said with the cameras, it's an issue of availability. Everybody is ordering these things to, Penn State is doing it, all school districts are doing it. So when they're available, you got to order them, and if we need them, which I believe we do, since we went to this synchronous remote instruction, we're going to need them sooner rather than later. And my experience is that a lot of this stuff is back ordered too.
And since COVID is not going away anytime soon, we don't know how long we might be in need of something like this. So it seems pretty.
Amber, I believe that Chris Weekland has something to say about Huddle.
Okay.
Yeah, thank you very much. Huddle really is a pretty diverse tool that our student athletes and coaches use. It's not just to record and document film, but it is the main vehicle to communicate to college coaches for post-secondary opportunities. And whether or not we have athletics as we know it this year or this fall or not, it's still going to be used and relied on tremendously. And especially if we don't have athletics, they'll be using that platform and that vehicle to communicate and try to create opportunities for our kids in a way that as we discussed within our department, very creatively, but Huddle is that key element, is that key entity that's going to allow our kids to get exposure and get connected to college coaches. And without it, it really will, I'm afraid, create an opportunity gap there for our kids that might be very detrimental in their opportunities to get in front of our college coaches and advance and have post-secondary education. So it's going to be a really valuable tool. It is a very valuable tool, and it will continue to be moving forward, regardless of what athletics looks like this fall.
That's helpful. Thank you.
So it seems like we don't want to further disadvantage kids who might already experience a less than normal season this year. Amy?
Well, since Chris was there, on average, how many students do we have do signing each year over the course of a year? So
yeah, this past
just
year,
roughly off the top, I know it's ballparking.
Right. We've had around 40 who celebrated in our signing program, and many others have just opened up doors of opportunities beyond just signing with different programs and playing postseason. But
the question wasn't a critique; it's just a ballpark. So in terms of how we spend on kids' opportunities.
Right.
Like,
and about 59% of our athletes are participating in athletics. So a lot of them enjoy that, take advantage of that platform to help them.
Okay. Are there questions on this item?
I just want to follow up with what Mr. Weekland said. I mean, even with club sports, D3 sports, things that don't offer scholarships, it's definitely a bonus to get you into the coach's eyes, so the coaches can see what you look like on the field.
So even club sports, it's not just for the students who are with okay. That's
or I should have said on the field or on the ice.
So it's available to students playing club sports as well?
That is correct.
Okay. Dan?
This is what I mentioned, and so it seems that in terms of the cameras, the camera equipment, and in terms of the Huddle software, in both instances, it sets us up at a disadvantage in relation to really having the resources available that would enable our kids to be able to learn in the classroom at the elementary level, or to compete, if you will, for secondary athletic opportunities. That both of these are necessary. Otherwise, we're sending our kids back. Thank you.
Laurel?
I understand the importance of the cameras and all. My concern is the model as a whole, and also whether, there's that piece where you're getting something, but is it worth the investment? And I think I asked this even last time in terms of, might we really be better off if we're going to do this, spending more and getting a better product? We basically are learning nothing about, and I know that our administrators have worked on it and our technology people, and I do appreciate that. It still would be helpful for us to see more instead of just $35,000 for cameras, so that we and the community know what we're getting. And that's what I was getting at. I understand the time crisis. I wish it weren't the case, but it is. So I understand that, and I'm certainly not going to vote against this entire thing just because of that. But understanding better what we're getting and how those decisions were made, and what the long-term utility is, what we might use them for in the future, that type of thing, would be very helpful to have in this memo as we prepare for the meeting.
Other questions on routine approvals? Okay. Is there any public comment on the routine approval items? Okay, then we'll have a roll call vote.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell.
Yes.
Okay, so that item has passed. I'm going to suggest that we adjourn the meeting for about 5 to 7 minutes, maybe, to just take a quick break. And then we'll, I think we can just put our screens on like mute and stop video and whatnot, take a quick break and come back for the action items in a few minutes. Okay, are we all ready to reconvene? I guess whenever you're ready, turn your cameras on or unmute. Okay. So we are moving on from routine approvals onto the action items at this time. Oh, first I should say I'll officially reconvene the meeting. So item 6A under action, our next item, and this is SCASC Voting Delegate 20 PSBA Legislative Platform. And we actually need to, I don't have a motion for this because I wasn't sure who, that we had 3 volunteers. I did hear from Lori and David who were interested. And if anybody else is interested, if you could let us know now. Anyone?
Amber, I've done this before.
Would you like to do it, Dan?
I kind of know the drill by now, you know. David's been a great coach, and it's just Laurel was a great companion as well in this process. So
I'm happy to give someone else the wonderful experience.
But
it is interesting.
I wouldn't walk away from anything that David was involved with. You know, it's I appreciate we all appreciate all of his leadership with PSBA. So I don't want to. If we need a third, I'm up for it.
Okay, great. Is anyone else interested in putting their hat in the ring? Okay.
I would be happy to make a motion.
Thank you, Laurel. Would you like to do that?
I move that we select David Hutchinson, Dan Duffy, and Lori Bedell as our delegates to the PSBA convention. Is that how
Is there a second?
I'll second.
Okay, that's been moved and seconded. Any discussion on this motion? Thank you for thank you for committing to do the time. It is a significant time commitment.
It is also very interesting. It's interesting to see the different things from around the state. I've certainly learned from participating, and I am happy to have other people do it, not just because it means I'm not, but also because you learn from it. I mean, David certainly knows that, but we learn by doing that, and that's very valuable.
I'll comment just briefly that there will be at least one very interesting item on the agenda in terms of state equity and state funding for education. And that will be a very interesting conversation, I'm sure.
Good. Maybe we could get a update on that sometime prior to the convention, if possible, on what that agenda item is going to look like. Okay. And David, you're on the platform committee, right?
I am. So I was part of that process. I'm still waiting for the finished product to come my way, and I'll be happy to share that once I see it.
Wonderful. Thank you. Any other comments? Any public comment on this item? Okay, we'll have a roll call vote then.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Badal,
Yes.
Ms. Brandt.
Yes.
Okay, that item has passed. The next item, item B, under action items is policy 2, authority and powers. This is a revised version of this policy after having worked through the PSBA process for renewing policies. Is there a motion for this item?
Lori Bedell, so moved.
Leah, second.
Okay, that's been moved and seconded. Any questions or discussion on this item? Okay, we'll have a roll call vote then.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Badal,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion.
Yes. So that item has passed. Item C is policy 10, employment of friends and family members, as shown on the agenda.
Duffy, so moved.
Bedell, second.
Okay, that's been moved and seconded. Any questions or discussion on this item?
Just a shout out to Linda Pierce for crafting this essentially from scratch.
Mm-hmm. Thank you, Linda.
Thank you.
Okay. Any public comment? Okay, we'll have a roll call vote then.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Badal,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy.
Yes.
Okay, so that item has passed. Item D is policy 833, sustainability. This is a new policy for the district.
Duffy, so moved.
Leah, second.
Okay, that's been moved and seconded. Any questions or discussion on this item?
To echo Lori's comment earlier about Linda's role in crafting it, I want to acknowledge Lori's essential effort at researching this and basically creating a policy that provides an umbrella for our path forward in terms of addressing sustainability.
Yeah, thank you for all that work. And the rest of the policy committee as well. Jim?
Yeah, I just want to say that I think this came out really great, and kudos to the policy committee. This really, I like these kind of policies that are vision policies, and this really sets a nice vision for the district. So I very much appreciate it.
Thank you. Okay. Is there any public comment on this item? All right. Okay, so we will have a roll call vote then.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Badal,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard.
Yes.
Okay, so that item has passed. Item E, is the transfer and assignment of pupil transportation agreement from Long Motor Buses Incorporated to Fullington School Bus LLC.
Leah, so moved.
Bedell, second.
That's been moved and seconded. Any questions on this item?
I know in the spring during the emergency, we changed due to the requirements of the emergency, we changed the nature of our contract, and this is different. And I'm wondering if we can have an explanation for what is behind this recommendation, this change.
Okay, so in the spring, the prior contract with our busing contractors they were amended to reflect the fact that we were not paying them their entire fee last year. Also, I believe that we've had an amendment for a rate freeze recently. What you're being asked to approve tonight is the fact that Long's Motor Busing, I think it's pretty self-explanatory. Long's Motor Busing is transferring their rights and responsibilities with the district to Fullington School Bus. So Long's will no longer be serving the district in this manner.
So did they merge, Randy? How is it that they're passing the baton?
It was Long's request of the district to pass on. We were not dissatisfied from Long's. I can't speak if Long's as a company is folding, but the State College school buses will be now serviced by Fullington. And although we haven't had a school bus contract with Fullington before, we have had an exceptional arrangement for charter busing or coach busing with Fullington.
Okay, Laurel.
Yeah, so then if this is transferred, thank you for clarifying that, Randy. And then do the rates go along with it? Because I think it was a 5-year, it's a fairly long-term contract, the rates that were set.
Yes, that's why in your memo, it talks about that there was a contract and an amendment, and both of those are being assigned and transferred to Fullington.
Okay.
We're essentially substituting the name of Fullington for Long, and everything else remains the same.
Okay.
Okay. Any other questions? Dan?
Yeah, just quickly. And I didn't, pardon me for not immersing myself into the language of the contract, but given what you said, Scott, I'm going to assume that the fulfillment of Fullington's role in terms of conducting training for their staff and doing the kinds of preparation for the drivers that are necessary under our practices will take place.
The rights, duties, and obligations of that contract will now be assumed by Fullington. So they will have to do everything that Long's was required to do under the contract.
Okay, thank you.
Okay. Any other questions? Is there any public comment on this item? Okay, we'll have a roll call vote then.
Mr. Leos,
Yes.
Ms. Zidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson.
Yes.
Okay, that item has passed. The next item on the agenda is a memorandum of agreement with the Penn State University Office of Multicultural Programs for a graduate assistantship.
Bedell, so moved.
Duffy, second.
Okay, that's been moved and seconded. Questions or discussion on this item? Laurel?
Hi, can you just go over what the graduate assistant does? I know that we've had them. I didn't remember that we had paid the university for them as opposed to it being the work they do that the university supports by providing the graduate assistantship.
You bet. And Saria's here, and these are PhD candidates, and so it's a little bit different. So thanks, Saria, for being here tonight.
Absolutely. And Laurel, you are correct that last year we did have a graduate assistant that was working throughout the entire school year. This memorandum of understanding was at that time under development. It's taken about a year for this to happen. At that point, the Office of Multicultural Programs, on good faith of the district, recognized that it was not due to our error that the memorandum of understanding was not able to be pushed through. And so the Office of Multicultural Programs in the College of Education footed the entire cost of the graduate assistantship. Typically, yes, Penn State would foot the cost of the graduate assistantship if the graduate assistant, for example, is working at Penn State. This individual, for their entire graduate assistantship, is working in State College Area School District. One of their key roles and responsibilities is the Peer Advocates Program Coordinator. As of starting this year, they will be coordinating the activities of 70 students. They actually help to run and organize the Summer Institute. They support the Office of Equity and all events that happen throughout the school year. They support us in advertising and recruiting participation. They support in providing faculty, actually helping to host the faculty book clubs, as well as the parent book clubs. They will help co-host those things. They help with professional development. The individual who was in this role last year, her name was Deanna Burgess. She has now graduated and has now moved on, is now a professor at DePaul University. But even though she is gone, she is now helping the new person who's already been in this role and trained about 70 of our students this summer. And then they also support each of those students as they are picking up their projects as peer advocates and moving them into supporting the district. And lastly, but not least, because there's many other things that I can list that they've done, they also have supported in co-instructing our Bridging Divides course, as well as our social justice courses, in which they assist with the planning of instruction for those courses as well. And so there's a number of activities that the individuals do. And as Dr. O'Donnell indicated, these are typically individuals this year, as was last year. We typically do not take first-year doctoral students in this role. We like the student to have some past experience in working in schools and also have past experience with, for example, multicultural programs and development. The current graduate assistant is coming in with some extensive knowledge and working with individuals from various backgrounds, especially individuals who are immigrants, and comes with extensive information, but knowledge on that. And she is in her second year of her program. So typically individuals will come in their second year and then their final year and then graduate, and a new person will come in.
Thank you for that, and congratulations to her on her new job.
Yes,
certainly
and
they're doing a lot. Yeah, this is something that we had not discussed in terms of an expense item before, which is why it caught me by surprise. And that piece is probably worth reviewing as we go into the next year with Penn State. Certainly we're getting a lot of expert help, and the programs that you mentioned are ones that have become very important in our district and the work we're trying to do.
Correct. And Penn State actually foots half the cost of this. This is actually only half of the cost. So it's kind of split between us, even though we get the full benefit of the graduate assistant.
So they do the tuition and that type of thing, correct?
Correct. Yes.
Dan?
Well, I was just going to say basically that university has some skin in the game too in terms of supporting the students, the cost of their tuition. And I wanted to mention that when I read the agreement, and I assumed, I guess from reading it, that it would not involve summer work, but obviously with the training for the peer advocates in the summertime and all the organizational preparation for the year, this person will be working with us at least 3/4, if not 10 to 11 months of the year. So that's good news.
And yes, and typically the important part to note is that the person who's under this graduate assistantship, their graduate assistantship starts in August. But typically what happens is that individual, which we know for any of your interactions, for example, with Deanna Burgess, there was a tremendous amount of work that she put in that was volunteer. And she actually volunteered and supported me with no compensation for the entire first year of my time in this position before actually getting a graduate assistantship the second year. And that was, of course, not by coercion, but students find this experience to be very valuable for them. There are very few roles like this in the state, much less across the country. And a number of students, this is something they would be interested in following up in. So this summer, Ashley Diaz, who is the new person, did volunteer because she wanted to be part of the Peer Advocates program to get some advanced interaction with the students that she'll be supporting throughout the year.
Yeah. Thank you. Thanks, Saria.
Thanks. Jim?
Yeah, I just wanted to point out, and I don't know if this was said, that this is a 4-year agreement, and I see this as a really good thing, you know, to establish this relationship and have this shared position essentially. So this is great, and the fact that they pay part of it, that's also great too. Thanks.
Good collaboration. Okay. Any other questions? Saria, thank you so much for being here this evening. Okay. Is there any public comment on this item before we vote? Okay. All right, then we will have a roll call vote.
Ms. Sidney,
Yes.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos.
Yes.
Okay, so that item has passed. Item G is the elementary project change order, as shown on the agenda.
Duffy, so moved.
Bedell, second.
Okay, that's been moved and seconded. Any questions or discussion on this item? Okay, we'll have a roll call vote.
Dr. Bader,
Yes.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Sidney.
Yes.
Laurel, I'm sorry, I saw your hand up after we started voting. Did
Yes.
you-
I was going to ask for an update on the playground along with this change order. The change order seemed pretty self-explanatory, and we did get an emailed update, but it's not attached to the agenda. And I thought that was an area of public interest.
Oh, okay.
Okay, I can do an update and certainly answer any questions. The Spring Creek project is complete. The only remnant of that project is temporary fencing around the embankment slide, while the grasses and other planted materials are being established. Of course, we are currently still considering all of our playground equipment closed. So this is related to construction status and not actual use status at this point. The majority of the Coral Street project is complete, and we are just waiting on final safety testing and of the mulch surface, and that is scheduled for this Friday. So the most of the construction fencing will be removed at the start of next week, while disassembling the existing sliding board structure that was to be reused. Some of the parts were found to be unable to be reused, so we had to do a parts order to replenish those pieces that were not able to be reused. And they are scheduled to arrive the 24th, the week of the 24th to the 31st, at which point the contractor will remobilize at that site to finish the sliding board structure only. Contractor is currently working at Radio Park. They intend to finish that project the week of August 17th. We've scheduled the safety testing for the mulch surface August 24th. So we believe the contractor will be removing their construction fence prior to the first day of school. And similar to the other projects, anywhere where we are have some new grass seed planted. Those will remain with some temporary fencing until the grass establishes.
Great. Thank you.
I had a
Okay.
follow-up question.
Pardon?
Follow-up question on that.
Oh, okay.
So these were supposed to be done by the 7th, and I'm concerned with the grass and all that means that there will be part of it that will not be usable. I'm wondering, first of all, what caused the delays? Because the weather, I think this summer's been about as perfect for construction as I can remember. And what percentage of like how much of the playground will be inaccessible due to the grass, and whether there could be some help with getting that, whether it's getting sod or something like that to move faster.
Answering the second part of the question first, it's, in the context of the entire playground, these are relatively small areas. Specifically while we have the equipment itself closed, we're talking about embankment slides that are closed, whether the grass is established or not. So I don't see where anything to hasten the grass is going to substantially reduce the usability of the playground at this point beyond restrictions we've already imposed due to COVID. And I would hope that at one point if we evaluate those, I believe there'll be pretty quick turnaround to getting those pieces opened. Of course, weather was not a cause for delay, as with any contract. I can do some speculation, but I am not the contractor. I do believe in conversations with the contractor that working with natural elements such as finding and debarking logs, as opposed to buying equipment, was something that was relatively new to them and probably a little more complicated than they thought, and took them a little bit more time than they had allotted, and caused them to get behind on the schedule.
Okay. All right, Laurel, was there anything else then?
No, I'm not pleased with that, since they knew the nature of the contract and we were assured that it would be done. I'm still not sure whether the grass will be ready or not. I did get a chance to look at, drove by Coral Street, and it looks really, really amazing. Certainly different than what I expected, but I can see kids being very excited about it. I just hope that they're, sounds like Coral Street in terms of the grass may be the one the furthest along, but I'm not sure.
I think we should probably move on. Item I is item H is the Memorial Field change order.
Adele, so moved.
Hader, second.
Okay, that's been moved and seconded. Any questions or discussion on this? Okay. All right, we'll take a roll call vote then.
I had a question.
Oh, I'm sorry. I don't see your hand. Now I do. Sorry.
That's right. So Ed, consistent with some other questions that I've asked along these lines, in this case, we have over $51,000 of document issues. If I'm not mistaken, every single one of these is a document issue. So I was wondering if you could speak to them in general. If you recall, I typically ask if it's something that was foreseen or not. But the biggest one I'm concerned about is EC13. I'm sorry, no. It's GC17, which is the drainage question and issue. So I don't know whether it's just how it was written or not, but is the borough requiring us to do this, or they're just saying, hey, maybe this will happen because there are lots of other ways to control runoff. And I just don't know, not being able to picture exactly what the slope is that runs down into that wall. I'm just concerned that, again, we just see document issue after document issue after document issue, especially on Memorial Field, and it's troubling.
That specific change order that you referenced, GC 17, was one that I had a little bit of angst over classifying, whether it's a document issue or regulatory issue. It was clearly an item that Borough required after the approval of documents. I guess, if I wanted to argue on behalf of why it was a document issue, you might say that the design professionals should have anticipated this. It was something that was already built, and the borough looked at it. They didn't identify on the plans. They looked at the finished product and said it was unacceptable and required the changes. Assuming that may be leading down another rabbit hole, but assuming you're referring to, preponderance of document issues, this one might slightly lean towards being more of a regulatory issue if I were pressed to comment on that specific item. And I did put them both there and really hesitated over which should come first. But hopefully this explains it better than I was able to explain it in the memo.
And I mean, I certainly assume that we don't have a leg to stand on to push back on any of this stuff, because the code inspectors can basically do whatever they want.
That's correct. It's written, everything is written to the advantage of municipal officials, that they can make whatever requirements they want to make, either before or after, during a project.
Good. Thanks.
Laurel?
I was just going to ask either now or with the next item, if we could also get, maybe more appropriate with the next item, get the update on Memorial Field.
I can do it now if you like.
Okay.
So we are moving towards substantial completion on Memorial Field. Are expecting to have inspections pretty heavily over the next several weeks. We're currently working on final paving, final fence and wall work, final site work, interior finishes, and MEP and life safety issues. We expect that next week the construction fence will be removed as we're doing our final inspections, and our final code inspection is tentatively planned for August 24th or 25th, would signify substantial completion at that point if we achieve it. And following that will be punch list as we move from substantial completion to final completion.
All right, any other questions on this item? Is there any public comment? Okay, then we'll have a roll call vote on the change order.
Ms. Bedell,
Yes.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Zidney,
Yes.
Dr. Vader.
Yes.
Okay, that item has passed then. Item I is Memorial Field furniture, fixtures, and equipment purchases, as shown on the agenda.
Leah, so moved.
Lazard, second.
All right, that's been moved and seconded. Any questions? Laurel?
Yes, I'm wondering if this is an expansion because it's benches, trash cans, and recycling stations. Did we not have those previously?
So we certainly did not have any outdoor public benches. We had a bleacher assembly that was simply stairs and seats. There was no space for any public benches, so they did not exist. The trash, we did have trash and recycling. They were appropriate for a nearly 100-year-old stadium, but are in no condition. They were pretty well junk. What you would consider municipal trash cans sitting out in the open, not appropriate for the stadium project that we are currently using. And those trash cans are probably either being used in my shop, or some of them are probably in the landfill.
Use and shop is great. The landfill is a concern, but thank you for the update on that.
In other words, they were no longer usable. If they were reusable, we will reuse them.
You wouldn't throw them away. Yeah. Okay.
It's so hard to throw out a trash can.
I was going to say, is there any other discussion on this item? Any public comment? Okay. We'll have a roll call vote then.
Ms. Brandt,
Yes.
Ms. Concepcion,
Yes.
Dr. Duffy,
Yes.
Mr. Fazard,
Yes.
Mr. Hutchinson,
Yes.
Mr. Leos,
Yes.
Ms. Zidney,
Yes.
Dr. Bader,
Yes, I'm sorry.
that's okay, Ms. Bedell.
Yes.
Okay, so that item has passed. Moving forward now to information discussion. The first item is under student learning. It's the health and safety plan. And I'll turn this over to Dr. O'Donnell to introduce this item or reintroduce the item.
Sorry about that. I was muted. I think number one, we want to respond to the board members' questions this evening. Next Monday, we hope you'll take action on the changes to the safety plan, key updates. Obviously, we've been working on this, and even though you approved a version of this earlier in the summer, we've made some improvements. As was discussed earlier, we're collaborating with the safety team, and especially MACHEC, on taking a look at the new information from the state today and how that might factor into, when buildings are open or closed. And then we have members of the administrative team with us tonight. So I know that you have some other questions that you'd like to run by us. I know some of you shared some things ahead of time, and we passed those along, but not all of them, because some of them came in late in the afternoon. So what we'd like to do is just open it up to the questions you have, and also what do you think you need for your decision regarding this, but also the emergency instructional time summary, which in essence, both these combined obviously cover when schools are open. This plan in particular has 4 key variables in it right now, with how we would collaborate and keep an eye on virus in our community, anything related to the schools, and obviously a lot of procedures. So I think what we can do is open it up, Amber, if you want, either regarding questions or if there's any requests for additional information.
Okay. So let's start with perhaps questions that board members would like to answer before we have like any general discussion or commentary. If we could start with questions, and at the beginning, we wanted to make sure our questions were pertaining to sort of the infection control side that we needed to hear from medical professionals, and these are more administrative questions at this point. So I have a list, but I want to let others ask first. Lori?
Thank you. So MACHEC's comment about the likelihood of the virus becoming an issue once Penn State students come back really made me think this is important to ask. So assuming that we're going to resort to a fully remote model at some relatively early point potentially, what can we do to support families who don't have support systems for children who will be at home? And likewise, how can we support students with special needs in a similar way? Can we utilize classroom or gymnasium space to offer structured learning time for at least parts of the day? And if we can do any of those things, how do we identify teachers or paras or appropriate adults who could help supervise that?
Well, if the schools are closed, that's the question is, are they closed? We are working on a plan to have support centers, I'll use that term, for students with special needs. The question will be, will we require faculty to come in? If we're going to have learning happening in schools, to what degree would we have it? And would we require some, but not all faculty? We're also looking at, can we have supervision for students of families where they need to be in schools, whether it's, as you said, students with special needs, unique needs, ASL students, Title students, or students that have parents that, if they're not at work, that family is going to be really negatively impacted. Is there a way we can help our families now? There's no question we believe we'll have a capacity challenge on our hands if we can't require employees to come in to help us. I don't know how we could do that, but we are working on that, and we think we'll have a capacity challenge on our hands.
Can I ask one more question, or should I wait for
I
round?
think it's fine to just go ahead with your questions, and then we can go around.
Okay. What has the decision-making process for instructional delivery looked like? I've been made aware of team teaching models and resource sharing that seem to provide teachers opportunities to make the most of their time and share resources. And, I think that if this is in fact something that has been talked about and teachers believe in it and have buy-in on it, that it might be useful for them to, for us to have them feel like they have more buy-in and more of a say. So I'm just wondering how that decision-making process has been.
Chris or Deirdre, you want to weigh in on this? Obviously.
Sure. Lori, at elementary, we've done some things with scheduling. So we're creating a special schedule so that the entire district has the exact same special schedule. So if you are a fifth grader, it happens at whatever time that is, which you're going to finalize tomorrow. And then the fifth grade teachers across the district, every single day will have a common planning period. So you can collaborate and have a PLC district-wide. And based on our remote learning experiences from last spring, we were able to really leverage that district-wide approach for that collaborative sharing. Teachers did an amazing job of sharing things across the district. In addition, the Ed Model team that we work with have come up with pairing schools, like Radio Park is paired with Mount Nittany. And then we have a common schedule. Everything is exactly the same: reading, writing, math, science, everything, so that there can be co-planning. If the teachers would choose to do that, we can also have interventionists cross the schools so that we can access more kids and support more kids. If there's an interventionist at Radio Park who only has 2 kids, maybe they could be picked up by somebody at Mount Nittany, and then somebody at Radio Park could pick up something else at Mount Nittany. So really trying to share the planning and the collaboration across our schools and across the district. So that those are just a couple of the examples from the educational model that we've been working on at elementary. In addition, at elementary, the specials, we're also talking about having, how we have day 1 is art, day 2 is music, day 3 is phys ed. We're going to do 10-day cycles. So you have art for 10 days, then music for 10 days. So it has just one cohort to decrease any potential exposure. So I'll turn it over to Chris for what they're doing at secondary.
So secondary is a little more of a challenge because of the number of courses, the number of students in a course. And I think it would be a very tough challenge if teachers were co-teaching a course and had, like, say, 50 students on a Zoom call. I'm not sure the students would have a community with each other and feel comfortable as teenagers interacting with one another in that way. But absolutely, teachers share materials. They are encouraged to do so. They meet regularly with their department chairs and also their PLCs. So we've had a very strong lead up of collaboration before this, which will serve us well, continue to serve us well.
Thank you for that. And Deirdre, one thing you said triggered a thought that I had. How do we get art materials to remote students?
So we have these learning boxes that we've really it's been an organizational nightmare to pull that together. The building budgets are covering the basic stationery supplies, glue, crayons, and that sort of thing. And then through curriculum and COVID and central office funds, we've been able to supply art, music, phys ed funds so that everybody has a learning box. So if you're an in-person in school, you have the full complement of everything. If you're a remote kid, you have everything I just said, and we are going to work to have families come and pick those learning boxes up so they get the same thing. And if you're in the virtual school, you get the stationery supplies, and then the virtual school ships the materials, the curricular materials, directly to students' houses.
Thank you. Thank you. Laurel?
Thanks. On the memo, it mentioned as one of the changes, the limiting the number of students on the playgrounds. And it said this is response, I think, to PDE stuff, but especially on our newer playgrounds that are kind of different. But even like a school like Ferguson has a huge open area. What do they mean? Like, is it a state set limit, or what are you envisioning with that?
There is no state set limit, so it's more for discussion to talk about it. What will that look like? Do we need to do that? Do we have enough space to physically distance out there? So I think it's something that each building will need to assess. It gets tricky with the personnel that we have that cover recess. And so I think that we'll have to look at that and taking that in consideration also. So that might be one of those things we do and we pull back on if we need to.
Okay, so it's not that it's a hard and set, or that they've given us a new amount, like, 1 foot social physical distance, which I think was a great change, by the way.
Yeah, same here. Pretty much everything, Laurel, in the plan was nothing mandated. It was all recommendations. And so we're following through on the recommendations.
I do have some others, but other people probably have questions as well.
Okay. Jim, would you like to go ahead?
Yeah, sure. So we've been getting a lot of email lately, which is no surprise, and the email often ends with, let me know if there's anything I can do to help, right? And it's from parents, and it occurred to me because I've been doing Zoom meetings for a long time, and especially these hybrid Zoom meetings where some people are remote and some people are local, and it's very hard to jump in. So I know we're moving to Google Meet, but it's substantially the same thing. Are we thinking about appointing, or asking parents if they want to volunteer as facilitators? I found that when I'm running a meeting that includes both remote people and people in person, it's hard for the people remotely to jump in. Now, Google Meet has a chat feature, and so as a facilitator, I will often just pause the person that's presenting and say, so-and-so has a question, and so on, or allow them to raise their hand and speak or whatever. So are we thinking about that in terms of, I know at the elementary level, we normally have more than one adult in the classroom, but maybe at the secondary level, are we thinking about, taking a lot of these parents up on their offers to say, hey, could you facilitate, second period class or something like that?
Jim, I've heard the same question from a number of parents wondering if parents of kids who are remote can volunteer in any way to help with some of that.
I think that would really be up to each teacher to see if the lesson really needed that. We have talked about some management strategies and protocols for managing online students, and one of them was actually helping students pair with each other to do that work that you're talking about in secondary.
That's a great idea.
I'm not saying parents can't help. I'm just saying
that's a really good idea.
Because our students, they're really one class. It's just they're never whole unless they're all fully remote. And so, and then it's all online. So we figured this is a way to help get them to be a classroom community and interact with each other, and by pairing them that way.
Mm-hmm.
Okay, and then just a comment about, so the summer school program essentially had learning boxes or learning bags, and that seemed to work out pretty well, that there was a couple pickup times conveniently scheduled, some after work and some during the lunch hour, so that parents could drive by. In this case, it was Coral Street's bus turnaround and pick up either have the stuff placed in their trunk or have the stuff placed through the window of the car. And that seemed to work out really well. So I'm glad to hear about the learning boxes, and I think it won't be a problem to distribute them. I think you prototyped that fairly well this summer.
Great. Any other questions at this point, Jim? Okay, Gretchen?
Yeah, thanks. I have 3 questions. 2 are related to instructional time, 7B, and 1 is related to 7A. Are we doing both 7A and 7B right now, or just 1?
I think just A at this point.
Just A. Okay, so the health and safety plan. Okay, so my question that's related to the safety, health and safety plan is about air ventilation. And it's because I've been hearing from family or kids who are in the district and teachers who are in the district, so people who are in the buildings, that they're not clear that all spaces will have some type of air ventilation. And of course, this is applicable for contagion because of the aerosol issue that we were talking about earlier with Maciek. And so I'm just wondering, like in some of the, I mean, we have nice new buildings, and it's my understanding that it's easier to have better ventilation in the newer buildings than some of the older buildings. And what about the older buildings though? Is it possible to have proper air ventilation in those buildings? And then also in all spaces. So for example, the nurse's office or the teacher's lounge or the main office, sort of not necessarily classrooms, but are we really able to keep the air ventilation safe in all of the spaces in all of the buildings? And so because I've been asked this by several community members, I thought that I should go ahead and ask that now. Thank you.
I can respond to that. We have been working pretty rigorously with our consulting engineers as well as our vendors on this issue, and we are meeting the aspirations that were outlined in the plan. We'll have those in place for the most part within the next few days, and finishing things up as we get to the school year. When we talk about our older buildings, with the exception of Fairmont Avenue, our older buildings are 2001. So when step back, Mount Nittany Middle School is 95. Park Forest Middle School's 72. So, but the majority of our buildings were built in the 2000s, and every space in every building is capable of receiving outside air from the mechanical ventilation system that is present in the building. So what we're working on with our engineering team and our vendors is to maximize the amount of outside air and to minimize the amount of recycled air. And we're on track to have that work completed prior to the first day of school, as I stated. In addition to that, many of our classrooms have windows. Staff will be able to open windows as is feasible or at their discretion throughout the day at any point. For rooms that do not have windows, we are purchasing air scrubbers or air purifiers or air treatment systems, standalone air treatment systems, depending on what you want to call them. That would be, depending on the size of the room, either what you might consider a desk size model or or a floor standing model. You approved some expenditures on your board minutes, and we're starting to receive some of those units in and intend to have them deployed prior to the first day of school.
Yeah, I was also wondering about that. Do you think that I mean, I'm assuming there might be a supply chain issue just because lots of people are buying these right now. Do you think that they'll all be here in time for the first day of school?
At this point, I think there's a better chance than not. I believe we'll have them, but we don't currently have all of them. So I'm not going to make promises that I don't have control over. But based on what I'm seeing, I think there's a better chance than not that we'll have them all in place. We will we do have some in hand at this point, and if needed, we'll prioritize based on areas that are in the most need in terms of the way the mechanical system is delivering outside air. But just to repeat, our ventilation systems are capable of delivering outside fresh air to every space in every building, and we are working to maximize that.
And that's with the exception of Fairmount?
Even Fairmount does, even it's old.
Are there going to be people in Fairmount in the fall?
There are some limited programs in Fairmount. The Hearts program is the most notable.
And follow up in regard to ventilation. So if the spaces where there are not windows to open will have the air scrubbers, are we planning to keep the windows open in other places when we're running the AC? So I'm trying to understand like what the balance between window opening and the air handling system.
Sure. Every teacher is sitting in the class, and this goes for, this goes beyond COVID to just how our buildings are built.
Mm-hmm.
One of the things that I've, really stressed with our engineering team since I've been with the district is I want classrooms with operable windows. And in most cases, the teacher sitting in the classroom where they have the ability to open windows while the AC is running, or they have the ability to open windows while the heating system is running.
Right.
It's not great for energy efficiency, but certainly in this type of a situation, it does allow another opportunity to exhaust air from a space and introduce fresh air.
But will we have a specific policy or expectation or procedure for what we expect teachers to do? Because I guess my question is, if we feel like rooms without windows that open need air scrubbers, then do rooms with windows that open but are not open need air scrubbers? Does that question make sense?
It does, and it's put me in a difficult situation to even advise on. I mean, when you look at CDC guidance, they've consistently talked about opening windows when appropriate, and talked about issues around allergens, and during periods of high allergens, maybe you don't want to open windows, and it almost kind of leads you down a path of, do we want to have some sort of an announcement over windows are opened or closed today? And I'm not prepared to do that at this point. If we do get into a situation where it gets too confusing or we run into problems, certainly we could go down that route. But at this point, I think we're leaving it. At this point, we don't have a policy or procedure other than to let staff know they have discretion to open windows. I think it's a pretty, I hate to say everybody knows, but it's a thing that's been pretty well publicized that fresh air is helpful. So it's a difficult situation, and we'll work on managing it as we get into the school year.
Okay. I think that's tough because if it's safer to have the windows open, then, there should be a similar safety expectation across the district. But if we feel like that our air handling systems are bringing in enough outside air that it's a moot point, I can see why it's a challenging issue. So, okay. Any other questions related to ventilation while we're on this? Okay. Laurel, I see your hand up.
Yeah. Question, this sort of is on outdoor education, because we know being outdoor is good. Has the district been able to get any tarps or other equipment that will help us with having more students? Or are there any particular plans that you've made, recommendations to help teachers get kids outside, even if it's for learning as opposed to for recess, I'm thinking?
I think with the synchronous model of remote students, that would be very difficult to just unplug and say, have all your lessons outside.
Mm-hmm.
It's good to know. What about in the hallways? Have we done anything to make hallways directional? I'm guessing most of us saw the picture of the hallway in Georgia. And I'm wondering what we're doing to make sure that picture of our hallway is not splashed across news cameras all over the country.
Well, right now in our secondary schools, our largest schools, we'll have less than 40% of our students. If we're in buildings, we'll have less than 40% of our students in buildings. Jean, if you want to respond to any procedural questions at the elementary level, although some of our buildings will have a lower percentage of students enrolled in the building than others, their per classroom numbers will be higher than secondary from what we're seeing. We've also recently been adjusting some staffing based in schools that do have a higher percentage of in-school kids. So I'll let Jean, do you want to talk to the procedural points?
Sure. We are recommending directional walking. Also, when students are walking, they will be 6 feet apart, so they will walk through the halls accordingly in that direction. A lot of the mask wearing, walking in the halls, those types of things will be part of the school-wide positive behavior support plans, which will actually teach those behaviors. And so that information and those details are being worked out by the building principals.
I think the sooner that everyone can know that, and that I know next week is when you start working on the parent handbook. But I think those are things that the parents can help reinforce as long as when they know about them. So the sooner we can get that out to them, the better. And then I was also wondering what other modifications maybe have been done in the buildings to help get them ready for students.
A lot of signage. So we have over 4 different signs for each building. Mask wearing, social distance or physical distancing, signs and symptoms, those types of things. In addition, we have floor mats going on the floor for physical distancing. So you can see what that space looks like in high frequency walking areas, cafeteria, the main office, in the hallways around certain areas like the restroom and things like that. So those will be in place before school starts.
Right. Any other questions? I had a few questions, which I think are for Jean. Mm-hmm. So in regard to face coverings, I think it might be helpful to provide guidance soon to families on what would consider to be effective face masks and what might not be effective face masks, because I think parents are probably scrambling now to make sure that they have those on hand. Because there's been some studies on like neck gaiters or bandanas that really don't hold any benefit, to make sure that people aren't buying the wrong thing now. So
right. So the basic direction on that is 2-ply cotton. So even the gaiter is okay if it's cotton and it's 2-ply.
Right.
Maybe double up your gaiter. I don't know. So that's what we've been saying all along. We have the family handbook just about finished, and so we have direction on that in there. related to how to wear a mask, what the mask should have, what are the details behind that. In addition, we have over about 3,000 masks that have been created and donated to the district. So we're going to distribute those around the building so that we can provide students with extras when they need them and staff extras.
Great. Okay. And then I had a question in regard to like quarantine instruction for families, especially those who might be coming back from vacation or travel prior to the start of the school year. If whether we'll be advising families to please quarantine their children for 2 weeks after returning from one of the hotspots on Pennsylvania's list of required quarantine locations.
Yes, and so we had a discussion about this last week, and I don't think Bob was available for that discussion, so I wanted to follow up with him on some thoughts on that. We do have the quarantine list available. We're talking about falling similarly to what HR has recommended, and if you've wore your mask and you were not knowingly exposed and you followed those kind of mitigations, would we consider that as being okay to return if they symptom check daily. So I want to have those final conversations before we say how we're going to manage that specifically.
Then another question I had, and this is more in regard to the learning model with the remote learning, and it's whether we've considered a user agreement for families, and maybe this is a question for Scott Eder in regard to concerns about privacy and the potential for recording of segments of classes or other students. I guess, one of the concerns that I've heard from a few parents and teachers is about the potential for, like maybe pranks in terms of students recording clips and posting them online, or, otherwise using the content in inappropriate ways, and whether we might consider some kind of a user agreement for what would be appropriate use of those technologies.
I think that's something that we're talking about administratively right now, and I had seen a Google Doc earlier this evening on that subject. So I don't think I do, or the administration has a final answer or recommendation, but it's something that we're discussing.
Great, thank you. Okay, I think maybe all my questions were answered. I had a question about lunch availability for remote learners, but it sounds like that is something the state or federal government's working on, and that you all are getting good to go on, that we're gonna have a plan for that. Okay.
Yes, Amber, Megan shared at A-Team last week that the FDA approved the, not the FDA, what's the lunch?
USDA.
USDA approved that students who have free and reduced lunch, even if they're remote or in the virtual school, can access lunches.
Great.
And I think Megan suggested that there was going to be a once-a-week pickup, like at the Delta school, where they could pick up all their meals.
Wonderful. That's a relief, because that shouldn't have to be a factor in terms of families.
100%. We cheered when she announced that.
Great. Okay. And I know Jean had given us some updates on contact tracing capability. So I think that's all my questions on the health and safety document. Gretchen?
Yeah, I hope this is the right place to ask this question. I was just looking at the emergency instructional time, and my question is not about the time, and it's not about the safety plan, but I guess it's about the ed model. But you asked one about the ed model, so then I thought maybe this is the appropriate time. And my question has to do with I'm picturing elementary age kids in front of a computer at home from 8 to 3. And having gone through that myself, so I speak from personal experience here, but also from community members who have, contacted me about this, for the kids who are doing remote, now that we have the synchronized model for elementary, are the kids at home expected to be in front of the computer from 8 a.m. to 3 p.m.?
So Gretchen, this is Deirdre, we wouldn't expect the kids to be online, even in the previous model where it was full remote or when it's synchronous remote. And I think Chris can add on to this at secondary for the whole time. You know, we have to, you know, work with a little bit of grace and patience as our teachers work through this new model. So that there's a schedule that will be developed so that parents know when students should log on so that they can access those synchronized lessons. There'll also be times where students will be asked to do some asynchronous things offline. There will also be times, for example, in the first week of school when we're teaching the health and safety lessons about standing in line 6 feet apart. That's not a lesson that the at-home kids need to have. So that would be time where those kids would have a screen break and would not be connected to the classroom. So trying to balance all of that is a lot for our elementary teachers to think about. And we have 2 more ed model meetings, which is going to be the focus of our work this week to work through that a little bit more. So I'll just toss it off to Chris for the secondary question.
So teachers will communicate the students will check in every day with the teacher, and then the teachers will communicate when they need to be online. If it's going to be explanation, for example, of a project, they'll want them there. If it's work time, they'll let them log off.
Laurel?
Thanks. I would just want to clarify something that Jean said earlier on the quarantine. So I think right now, Pennsylvania doesn't have am I right that they don't have mandatory, but recommended quarantines from certain states or certain hotspots, but it's not mandatory?
Correct.
But I thought I heard you saying that we might have we might say, well, if you did this, you did this, you did this, you satisfied that. Is that what you said? Or are we going to, in effect, enforce or request the same?
I need to have further conversations with the team.
Okay.
We were looking at what HR had completed, and did we want to do something similarly, or were we going to do something a little bit more restrictive? So I'd like to have those conversations before I answer further.
Okay, I thought you were saying something less restrictive, and that's where my sort of alarm bells went off.
Less restrictive in what the recommendations are, but the same as what we're doing with our staff.
It would be helpful at some point, even if, you know, once those conversations have been had, to know what
Absolutely.
what we're telling them.
Yep.
I do have some other things. I just wanted to get back to that before it disappeared.
Okay. All right. I'm trying to see, are there any other questions specifically on the health and safety plan, with the instructional time plan being the next item? Laurel, I think you had a handful still that weren't answered yet.
Yeah, I was wondering if people at home, if parents have questions, on health and safety, would they go to Eugene? Or where should the building principals, where should those go?
They can come to me, and I can either direct them in the right place or I can answer them.
Okay.
The ones that go through the principals, if they aren't comfortable answering them, then they reach out to Jean if it's a new question.
Okay. Okay. So are we good for that item then? So then we'll move on to the instructional time document. And Dr. O'Donnell, do you want to introduce that?
Yeah, I mean, at our work session, we gave an overview. Will shared that. So we included this on your agenda for further questions regarding this, and I know there are some. So I will, unless you have anything else to add since Thursday, maybe we can jump right into the questions since it's 10 o'clock. You're on mute, Will.
Okay, thanks for pointing that out. The only thing I wanted to say, that the one thing that we added from Thursday is at the very end of the memo, we did put down the choices that are from our family respondent poll, so that the board is able to see and the community is able to see the numbers of the 3 choices that are available and how our families selected at each of the levels.
Mhm.
Okay.
It's very helpful.
Yep.
All right. Board members, questions? So in terms of decision making, approving, and we talked about this at the work session, but just to recap, that when we approve this document, this allows for each of these modes of instruction. It's not approving a particular mode of instruction. So if we needed to pivot, depending on circumstances, we're able to do that within what we've submitted to the state.
Sorry, I just poked on at Will and I did the same thing. The key part of the current safety plan has 4 variables where the decision to close buildings would occur in collaboration with the safety team. We are discussing, and the state now put guidelines out about more specific cut points, so to speak, based on some different data points. So our plan is to revisit that with you this coming week. You know, and if there's anything you need or suggestions that the board wants to consider, then, you know, if there are any tonight, then, you know, we should kick those around this evening as we prepare to respond to your questions on Thursday.
Board members. Dan? I'm sorry, you're on mute.
That's okay. I just was.
There we go. Yeah.
Wanted to sort of touch base. First want to acknowledge the work that everyone's putting in, but I'm really, I have a laser focus right now on the challenge at the elementary level for the way in which they're going to try to integrate in-class instruction with synchronous remote. And Deirdre just mentioned that there's still a lot of work upcoming to be able to create that, develop those ideas, that model. And, you know, I could speak from questions I would have about what that would look like, but it sounds like they're still in the process of trying to figure out how they're going to make all that work. I will be looking forward to hearing what kinds of accommodations that they're able to arrange, particularly for the young ones, particularly from K through 3. Developmentally, just the differences at that level compared to even the students who might be a year or 2 older are pretty challenging. So, and that's just, I just want to acknowledge the ways in which, in terms of the teacher's attention and focus on all the learners as much as possible. For starters, you know, seated 6 feet apart in their classroom, but then complicated by the fact you're going to have learners at home at the same time. So I just want to acknowledge all the work and the significant challenges involved in that. So that's about it. There are no answers to this, at this point. I would just simply say, maybe what I'm asking would it be possible to be reassured that we're going to be assessing the outcomes of these interventions as time goes on, so that if we can gather sufficient information at different levels, let's say between early primary and intermediate, are there some adjustments that need to occur quickly? I apologize for the noise in the background.
And I think what I would like Deirdre to speak a little bit to, you know, early on, until we have the technology that we're planning to use for any time period that we are in school, what they're planning to do their best to make it work as well as possible. You know, obviously, as we move through the summer, being unsure where families stood on the different options, and then how to staff it, and then how does it interface with the safety plan if we are in and students or families are quarantined or faculty is quarantined. And we know that what we're asking is challenging. And, my conversation with Deirdre and Vern around the elementary piece and has been, do what you need to do to scaffold it, just like we would want for kids. We don't want to have teachers think that we're expecting to do what they would have done a year ago when we opened up the school year in this particular situation. It's just not possible. So, if we have any time where we're able to be in school with the kids, we want them to do the best they can and be reasonable about what we're asking them to do. So Deirdre, you want to speak to or respond to Dan, but also would you touch on the technology workaround idea that you guys are working on?
And then Justin Hetrick's still on the call, so he can weigh in. So we're prioritizing 3 things at the elementary level. The first is obviously the health and safety plan. So the students in school, we need to make sure that we're creating the safest environment by the 6 feet distancing, make sure kids are wearing masks and walking in the halls, and then all the regular safety things, even pre-COVID. So that's a priority, and we're going to ask for patience from our families at home while that's a priority. The second thing we're prioritizing is community building. We think it's very, very important that each classroom has a community between the students who are in person and the students who are remote. So that's our secondary priority, particularly as Bob has talked about, if and when we need to pivot and move to full remote. We've had this classroom of students who have worked together, who are in person, and the students in person will be able to see the students at home because we'll be able to project them on the board through the computer. And then the students at home will be able to see the students in the classroom when we swivel the webcam to the classroom, because we need to have those interactions and those visual face-to-face so that the kids in both environments feel like they're a classroom. And we know that's a big stretch for K-1. And I was working with the K-1 teachers at Radio Park today, and we'll have a follow-up meeting with them later this week to really brainstorm how to best do that. And what we're thinking about is, well, what do you know? What has worked in the past? Let's start with what you know, and then talk about how can we adapt that to make this work in this very complex situation, especially in our K-1 classrooms. And then finally, the last priority is instructional technology, because if and when we go full remote, the opportunity to make sure that kids have access to and know how to use the technology in front of them is going to be really important. And Justin Hetrick and his whole team has been absolutely incredible with supporting us. They have created web pages for both families and faculty so that they can have information about how to access, how to log on, how to work the webcam. And to your question, Bob, about our plan B if the webcams don't come in, and Justin, please, if I'm not saying this correctly, pipe in that the elementary teachers who are really adept at using their document cameras can use the document camera actually as a webcam, so that the sound and quality isn't as great as a webcam, but it's a transition. If the webcams don't come in, at least we can have that connection. I don't know if Justin wants to add to anything I've just said.
I think you covered it very well, Deirdre.
See, I was paying attention in all the trainings I've been in, so does that help, Bob?
Yes, thanks, Deirdre. Appreciate that.
Deirdre and Justin and Bob and everyone, thanks very much for trying to bring us up to speed as we're in continue to be in the process of a significant period of development. Thank you.
Who's on mute as well. Thanks for those answers. I guess I want to shift the conversation in a slightly different direction. We've heard from the state today in regard to some updated recommendations they have in terms of benchmarks for being in or out of school. And we still need time to process those in terms of looking at our own community and what those could mean here. Based on data we've seen here. I continue to be just very concerned that the data that we have currently reflecting the current infection levels, the numbers and the positivity rates in testing in our community don't represent the community that we will have the week that school starts. And so considering many of the, we've certainly heard concerns from community members and faculty members in terms of how we are going to assess the safety of starting school, in school, and remaining in school. And I think it's, fortunate that we'll be continuing to have some of these conversations over the next week before we need to vote on Monday. I guess something I think we should consider, and I'm not necessarily arguing that this should be what we should do. I'm not sure that this is what I would argue we should do, but to at least consider the merits of knowing that the first 2 weeks of school, or whether I'm not sure if it's 1 week or 2 weeks or 3 weeks, but there's a period of time potentially when Penn State restarts that we have perhaps a window of opportunity to be in schools with all of our safety measures while we still have low rates of infection in the community, and we don't know what's going to happen after that. And so I think it may be worth considering the merits of what is the best use of those couple of weeks, knowing they may be temporary, and then considering taking a planned period of remote instruction after that point, so that we're able to watch what the numbers are coming through the university and into our community without having all of our teachers and students in our buildings during that period of time in late September to early October, when we might reasonably expect to see some of the most concerning growth in infections in the community. So I guess that's something I would like us to consider. I'm not saying I think that's what we should do, but I think it's an option we should evaluate the merits of doing. So obviously we'll have a work session on Thursday to further discuss what our options are, and we need to make a decision on Monday. So, and then the second thing I wanted to, that's sort of related to that question, is getting feedback from our teachers and staff members in our buildings in terms of their support for our plans moving forward, to ensure that the people who were asking to go into classrooms with students are ready to do so. And this is really, like, even considering the option of being in a remote model is really, really sobering. And the points that the pediatricians made this evening are not in any way lost on me, but considering also what potential risk there may be, both to family members of students and teachers and staff members in our buildings, I think getting some sense of where our staff are as we're moving forward would be helpful. So that is all from me. Amy?
Yeah. So I want to echo Amber's comments. I think largely so many of our community and so many of us anticipate the need to pivot to going fully remote at some point in the near future. And I think, as Amber alluded to, the lack of data that we have as to when that tipping point is going to occur is a big source of anxiety for a lot of individuals, both parents and teachers. And that's understandable, because we're having a drastic change in data input in our community. And anybody who's learned about exponential growth understands that the pond can only be covered this much, and then within 2 days can be covered this much. And I know I'm on Zoom, but I'm gesturing wildly. So
yeah, with
that's when that tipping point is going to occur is certainly a concern. And so in considering whether we should proactively try to decide what that window of opportunity could be, and thinking about switching to a remote status while we assess whether that happens, is something to consider. And it could wind up being temporary. It could wind up being longer term if things don't go well. I think too that Maciek has mentioned that he would try to give some expertise as to what that window might look like if we were to go there. But I know he also, in his field, typically looks at very small increments and tries to make decisions as we go there. And that's certainly a route we can take. But I think that finding that balance between what gives some level of comfort is certainly one possible approach. I do think, though, that we do have this window, and I think having kids and teachers together is really critical, particularly as we are entering a new school year. That's the biggest thing, that kids are endeavoring into a whole new year with all new relationships and all new teachers, and so that those experiences will be really, really important. So I see some other hands up. I'll let some others maybe comment on Amber's feedback.
Gretchen?
Yeah, thank you. I am thrilled to hear what you said, Amber, both points. I think that a lot of people have been thinking that, and to hear it said out loud is such a good thing. And so I think I just wanted to show and communicate my support for those two ideas, and sort of ditto what Amy said, that if we do go in person for 1 to 3 weeks, that's really an opportunity to build community and within the classrooms, and to focus on the relationships. And I know Dr. O'Donnell has said that so many times. I've heard you say that, Dr. O'Donnell, that it's really about relationships. And so those first 1 to 3 weeks, building those relationships, it could be just so significant for both the mental health, which the pediatricians addressed, as well as the learning opportunities that can be opened by building those relationships for those 1 to 3 weeks at the beginning of the year. And then to monitor the numbers, Amber, as you had mentioned, and see what happens, and do it in a safe manner, with a plan, which sounds like it makes a lot of logical sense. And then also just taking into account that voice of the actual teachers who will be in these classrooms trying to execute this safety plan that has been so carefully and thoughtfully put together. But really getting their input, because they're the ones who are going to be in these rooms doing all of these things and trying to make all of these things happen. And so to hear their voice and take their voices into account just makes a lot of sense. It almost feels like that voice has been missing, and to have that opportunity to see, is this doable? From the experts who were asked to implement this, is this possible? Is this feasible? And then knowing that 89% are feeling like maybe it's not, and so to actually take that into account into our decision making makes a lot of, again, logical sense. So I just wanted to communicate my support for those two ideas. Thank you.
And I guess I'd like to back up a little on what I'm suggesting, and to say that I don't know that there's a district in the state that has been more thorough in its planning around safety and preparedness for doing this in the safest possible way, and immersing ourselves in the known science thus far of this virus and how it's spread, and what we can do to mitigate exposure for kids and teachers and families in our community. I'm pretty sure there's probably not another district that has done the work that we have done here to this level. I'm also not sure there's another district that has quite the dynamics that we have in terms of the small size of our community and the large size of the university, and the balance of that population change that's going to occur. And so that's where some of my concern is coming from, not because I'm dissatisfied with the safety plan. I think it's really an impressive one. So, Laurel.
Yeah, a bunch of stuff. Let me try to be efficient in that. I want to get back to what you talked about, Amber, but I did have a couple of just pretty straightforward questions as well. One of them was about guest teachers and what type of training, because the classroom will be so different. Do we have a plan to provide training sessions for guest teachers or substitute teachers?
Yes, we do.
That they will get training so they know what they're working into. Good. Someone asked me if it was true, and I don't know where they got the idea, and they wouldn't tell me, that teachers are supposed to be in front of the room the whole time with plexiglass around them.
No, that's not accurate.
Okay, so they don't have to stay in the front of the room and they won't be surrounded by plexiglass.
No, that got minced, I think, confused along the way with the 15-minute kind of guideline to think about. And so it's about being in someone's presence for 15 minutes, and it's each individual. It's not the total class. And the 15 minutes comes from the day someone has symptoms of COVID, 2 days prior. It's about the viral load that 15 minutes can give somebody. And so they kind of keep that mindset of saying 15 minutes with someone is going to be enough viral load to be infected. And so that's kind of the guideline. It doesn't mean that in 15 minutes they're going to get it. Keeping in mind that 5% of the pediatric population is positive, it has been diagnosed, which is 19 kids total. So kind of set an unnecessary scare, but it was more of an awareness. And so that's kind of where that thought came. Okay, I can't go into the kids' bubble or the students' bubble, but you can, and you can monitor, just keeping in mind that viral load in that 15-minute is kind of a guideline to think about.
I think I followed that.
Right. If you had difficulty, imagine the staff,
yeah.
right?
And then going back to what Amber said, I want to follow up on Amy and Gretchen also, and being very glad to hear Amber's suggestion. I think we really need to be thinking about this. And we heard quite a number of people at the beginning of the meeting and commented on the options that we're providing students. And I think it is excellent that we are providing those options, so many options. The option that I have not heard anything about is at secondary for parents who feel that their children need to be in school for 5 days a week. And that can be a very valid concern that has all kinds of attendant health risks, as well as risks to the students who they will be in school with when they'll be in school, depending what those kids are doing on the days they're out of school. So that's an option that I think we need to really think hard about how we might help with that. And the other piece is options for teachers, because, and this is a question, what opportunities, what percentage of our teachers will have the opportunity, if they feel it is the best interest for themselves or their families, to be fully remote teachers?
I would just like to, the only reason, and I would, if the board wants us to survey our employees, I would like to know that tonight. The only reason we did not do a survey, and there was a number shared with you last week from a meeting that was had. I don't have any firsthand information on that. We teach kids, and I've seen the emails that the board receives from many people in the community that want to give our employees the option, the choice. And I think the decision has to be if we believe kids should be in school, then we need our people. We have 7,000 kids, and if 70-some% of them are planning to come in, we need people. And if we're going to pick and choose or give choice, then these are really competing issues. So, Laurel, you also said you want an opportunity for secondary kids to be in 5 days a week. If we're going to go and have competing challenges, we can't deliver on those goods. So I think we have focused on trying to develop as safe a plan as I've seen in any district. We're trying with a wonderful team to do that, and you have our commitment that we'll implement the plan. And if someone refuses to wear a mask, we'll take a hard line with them. Things like that. But if we want to give choice to employees, and I would love to do that more than anyone. I would love to look at everybody in the eye and people that are concerned and say, it's your choice. It just we if the board wants us to do that, then we can't have the number of children coming into our buildings that want to. So I appreciate all of these thoughts and respect where you're coming from. I would love to deliver the goods on every one of those. I just think we want direction. If the board wants to change the direction of what we've been planning, then obviously we work majorities and we'll carry out the plan and how they change. But in response to your comments, Laura, I don't think we can make promises we can't deliver on, and that's why we didn't go down that road.
Yeah, I mean, it's an awful lot to try to do.
Yeah, I think we're just in a very different position than Penn State in that, they don't have to supervise college students the way that we have to be able to supervise students in buildings.
Yeah.
And so I think there's an extent to which we have to make the decisions as a system. Okay. Scott?
Yeah, I guess, similar to what Bob said, I'll approach the second item first regarding, teacher input. I mean, I would hope that the teachers have had input, through this process. And I think to Bob's point, if we're looking for a deeper level of input through a survey or something like that, I think we have to be really clear with what we're trying to get from that survey. What information are we trying to get? Because, if we ask the question and it comes back, then we have to be able and willing, to act on whatever that information is we're asking about. And I don't know that we're in a position to do that, just as Bob was saying. The other thing, and similarly, I mean, I'd love to be able to give everybody their individual choice, but I mean, geez, when I think about the essential workers out there, if a teacher isn't an essential worker, I don't know who is. When we look at the value that they provide, to the kids in the district, and I doubt that there were surveys done of grocery store workers and healthcare professionals about whether they, felt like they wanted to come to work or not. They just did what they were asked to do because they were essential workers. But I get that, these are a little bit different situations, but it's again, I just don't know what information we'd be trying to gather from getting that additional input. Regarding the first item about kind of having a period and then an intentional pause, I mean, that really concerns me because we're trying to do everything we can to get kids safely into the buildings, and to have an intentional pause just to gather data. I mean, why can't we just continue to gather the data while the kids are in the classroom? I mean, we're going to have triggers, we're going to have decision points at which we will decide whether, remote learning is now an appropriate option, or whether in-school learning continues to be, viable and safe. And boy, what I'd hate to do is to go to school for 2 weeks and then have an intentional, 4-week pause, and 2 of those 4 weeks or 3 of those 4 weeks are, very good statistics that the kids could have been in school, and the week after we come back, something changes and now we're out of school. So now we effectively lost, what ends up being, almost half of a marking period just because we wanted to hit pause and gather data. So, I mean, I think the way the model's written, we're going to be gathering data, as Maciek said, we're going to be gathering data on a daily basis. So I don't see the need to have an intentional, non-school data gathering time period. And then the other thing, again, definitely not a teacher, but boy, I can't imagine how a teacher would want to prepare for 2 weeks of school and then 4 weeks of remote and then a complete unknown, after that. At least the path that we're going down, you're either remote or you're hybrid, and the only step after that is remote. It's not this back and forth, kind of a thing. I understand we could come back if the statistics, if we're hybrid and then we go fully remote and the statistics change and we go back to a hybrid or whatever it might be, then that's something that would occur. But to intentionally bounce back and forth, I mean, I think it creates turmoil for the kids. I think it creates turmoil for the families, for the teachers, and I just don't see what we gain from it that we couldn't get with the ongoing models continuing. So those are my thoughts on those two items.
All right. Any other responses or questions or comments?
Yeah.
Amy.
I guess so. To answer part of your question, Scott, is I think I do agree with everybody that the plan as the best, I think anybody could have, the best experts could have created. And I think the options for parents and the flexibility that has been created by the instructional plan is the best it absolutely can be. And I think the one hang up is the incubation period of this particular virus and the fact that we don't have testing results immediately. The lack of rapid testing results is going to have profound effects. And we've had, our country and our state have had months and months and months to try and create systems to overcome that, and they've failed horribly. And so we're in this position not because of anything that our stellar and amazing staff and community have done. We're in this position because higher level structures have not done what needs to be done to create adequate levels of testing and availability of testing and turnaround time in testing. If we had that, then we would have real day-to-day data. But the results that we're getting, say, today are patients that were tested anywhere from 5 to 10 days ago. So we're losing a week to a week and a half of information. And that's what the problematic thing is about turnaround time, is that while MatCheck is phenomenal and will watch the daily test results and will tell us a trigger point, without adequate and speedy testing, that information is already a week old. And so that's the conundrum, is that I use that lily pad and a pond analogy, and it's one Amber and I have talked about, and it's used frequently by mathematicians to explain exponential growth. And you can go from 2 lily pads to 4 lily pads to 16 lily pads, and then it nearly takes, I can't remember how many days, when you go from like 25% of the pond to almost the whole pond full, it only takes a couple of days. So that big jump between only a little bit of cases to suddenly a lot of cases happens quite quickly. And because testing is so deficient, that's what really throws a wrench in this whole scenario. And the reason why the thought is, what if we did take a pause? If we paused at the right time and things were going to, massively increase, if we're lucky enough to pause at the right time, we'll catch that before it's trickling into our community. And you're right, it's a somewhat of an if, it's a little bit of a gamble. But in terms of trying to balance what the status quo is right now and how we look at information, that's the big bottleneck problematic point if we want to keep the most people safe, both kids and adults. And, recent data indicates that minorities get sicker, more minority kids are more likely to be hospitalized. There are increasing data about kids being affected. In July, I think it was 100,000 kids tested positive. So we're actually testing kids somewhat more now. So there's a little bit of question about the rates in kids. And we know that we have a significant population of at-risk individuals. So it's tricky. But testing is the big hang up, and that's not our fault, and that's not the administrator's fault. that's other people's fault. But it's what exists right now, and we have to figure out how to cope with that and factor that into our decision making.
Laura Hall?
I didn't know if there were some other people who wanted to speak because I've said a lot already, but yeah, I mean, certainly, Amy, you nailed it in terms of what is not our fault, and yet we're the ones stuck trying to cope with, and the testing is a huge one. But there still is going to be, even if we had excellent testing, a sizable population that, at least for moderate, medium time, is going to feel unsafe in structures like school buildings. And I think that though it had been challenging, there had been a model that was not perfect, that was the remote model, that had disadvantages and advantages. And one of the big advantages was the community it gave the people at home and the ability to actually teach it. I think what we are asking of teachers is something that people study and study and study and study to try to do well. And what we're trying to do is something that may deliver poorly to both the in-student kids, and we just heard about, well, we can't really go outside because of the need to be synchronous, but also for the kids at home who are going to be trying to fit in here. And I had asked earlier today, and I appreciate the answer, I think it may have come from Jim, about getting background things like many of us use. I tend not to use it. But for our students, because if they're being projected up on a screen in front of their classmates and they've got a home situation that is maybe less conducive, and that then gets projected up as well, along with the student being projected. I think there are just real concerns for both sides with this hybrid model. And I understand the reasons we went to it. But I also wonder what we might be able to do, because the opportunity wasn't put out there of, okay, here's what this will mean. We did this with busing, right? We said, this is the model we have, but this is what it's going to take from our community, and gave people the opportunity to look at that and try to help out. And I didn't see that happen. I think the numbers came as a surprise to everyone. I haven't quite figured out where the surprise was, but it's clear why we, as you said, with Penn State is very different. They don't need to have a teacher in front of each kid, and we do. So I think that with all of those things, we've got a lot to think about and to really work out.
I'd just like to, Laurel, appreciate your thinking there. The challenge in elementary, when you staff with having 8 buildings, some being very small, is it's really inefficient to start. So it really was, where did the numbers fall? Like what buildings, what grade levels specifically? And when they tried to work through the staffing model of really staffing 3 completely separate systems, that's when we ran into a brick wall. We don't have an infinite amount of contracts to offer, and that obviously would help. And also that model really presents challenges if we're moving in and out of buildings, or later in the year, if there's a vaccine and people want to transition. Some people they were asking principals about transitioning on the front end. Well, when we go to remote, can I move back with my home school? And we don't have that flexibility with where we were going. And I think the principals, and obviously we have teachers planning on the ed model teams, but the staffing decisions and that structural decision, our administrative team came forward and said, hey, we really need to make an adjustment here because this isn't going to work. And as far as input into the big decisions of whether we go or not, we haven't asked employees about whether they want us to be in school or not, because it really, we thought we needed to offer 3 options to families and do our best to be in school in a safe manner if we can. So, where there's input, it's in respective parts that pertain to roles. And, I'm not going to tell you it's perfect, but that's really how we've worked. And I don't think the staffing model or the ed model is perfect. I think the perfect ed model is if we could be in schools and get back to where we were doing last year at this time, preparing for a school year where we weren't worried about this transmission. So I just wanted to respond and just share some of the challenges with us, and as well as where we did ask for input and where we felt we really could respond and include it.
Just really quickly, I'm not sure that asking for input much earlier would have been helpful necessarily in decision making, because in terms of having enough information about where we are with the virus and transmission rates, there's just been a lot that's changed over the last month or so. So to some extent, I certainly wouldn't fault anyone for not asking for certain kinds of input prior to now, because there's just been a lot of change over the summer. So Dan. We can't hear you.
Okay, Mark,
There
got it. Well, I want to just acknowledge Amber and Amy. You're thinking about this and trying to be flexible and adaptable to the realities, these changing realities and the shifting sands that they're moving under our feet, and trying to find a possible path. It's not appreciably different from what we had talked about before in terms of increasing infection rates and such, leading us to go to remote. It just accelerates that process a bit and leads us to try to anticipate a bump. There's another piece to this that gets my attention and I wonder about, which is the impact on families who have already committed to having their kids come to school physically, and whose capacity to supervise their kids at home during the school day is really limited. And I think there are many advantages for kids being back at school physically, being with their peers and participating in meaningful activities and such, and working with others in a group. And even if it's by, as Deirdre described, by way of video engagement with their peers who are learning remotely. But families are making a commitment too, and they're no less exposed in the community than by working or whatever their day jobs are than we would be. And in fact, we're probably less exposed because our safety plan is really rigorous. So I just want to kind of acknowledge the families who have chosen the physical option, and to recognize that they don't necessarily have the economic capacity to arrange for someone to be with their kids and oversee their learning remotely. We may, as we did last spring, we may wind up there again. But I just think I wanted to add that piece to the puzzle. And as Amy's saying, if we had a much more sensitive and responsive testing capacity, plus we could roll the data as it occurs, and see the decisions that need to be made in the moment they need to be made, that would be ideal. But for now, we're in an imperfect world, and we need, in a sense, we're living in the same world that the families do who have to go to work and can't be home with their kids during the day, and we have to acknowledge that part too. And so anyway, I just thought I'd add that to the mix.
Lori?
I just have a really brief comment, and it begins with just being super proud of our district. It's really been an amazing feat to have put together what has been put together. But my comment is that, the complexity and the enormity of the responsibilities that we have are significant. We understand this: kids, teachers, staff, families, and certainly the larger community. And the constraints that we are facing are literally unmanageable. And so I think it would be useful to consider what it would mean to provide clarity and definition of timelines for all of our stakeholders, and maybe this is a counterpoint to Scott's point that, would it be more useful for teachers to know that they will be going remote? It would certainly be useful for parents to know what to plan for their children. I just don't think there's any doubt that we're going to see a surge. And so because we know that, and because we can't do anything about it, technically, we should plan for it. We should help our teachers plan for it and plan to support families and kids who need it, and just bake that right into what we're doing. That's all I wanted to say. Thank you.
Scott?
Yeah, interesting, Lori. I appreciate your comment, and my comment actually is I agree. I'd rather see us plan for it, not just presume it's going to happen. And putting that 4-week pause in there is just presuming that it's going to happen and not taking advantage of literally every day that we have to be, have an opportunity of being in front of kids. So just a couple things. The comments about testing, yeah, I get it. However, I'm just telling you, MedExpress is turning around in 2 days right now. Now, could it be 2 weeks tomorrow? Yeah, but right now it's 2 days. So all this stuff about testing, results not being available, I'm not saying it's not valid in other places, but I can tell you that it's 2 days right here in State College to get a test turned around. I look at yes, it is, Amy. Don't shake your head. It is. I look at
Excuse me, Scott, a point of personal privilege. My spouse is a medical professional in this community, and not every provider can provide 2-day turnaround. Geisinger can, and maybe MedExpress can, but Penn State cannot, and neither can Mount Nittany. They are 10 days at some cases.
As a point of order, you're interrupting me.
Right. Well, you accused me of lying and not knowing what I was talking about. So I'm going to take a point of personal privilege and correct you.
Thank you, Amy. Appreciate that with your expertise. Additionally, there's this assumption that everybody has interaction on an ongoing basis with Penn State students. And I haven't had any interaction over the summer because they're not here. And I don't anticipate having any interaction going forward. Do you pass them in the grocery store or on the street or in Walmart? Yeah, but your interaction, that's not where COVID is transmitted. It's on the more close interaction. So, will there be surges at Penn State? Probably. Does that have to, actually translate to the community and our population? I don't know. Maybe, maybe not. And the other big thing for me is, we had our community speak to us when 70% of the families chose an in-school option. That's what they want. So if we're now sitting here saying you chose in school, but we're going to pull out and we're going to, intentionally go remote, I think that in itself is also going against our community's wishes. So that's it.
I feel like I want to address the question of, that in terms of a majority of families have selected in school. I did so myself for my secondary students. And I think that there's families in our community really trust us to make the right decision and make sure that their kids are safe, that we're making the right decisions for safety. And so I do think that there's a huge extent to which families selecting in school is because they trust us to make the right decisions. And so we just need to be really sure that we're doing so, because the safety of all those families is in our hands in terms of the decision that we make on this. So, Lori?
I just wanted to add that I've heard from a number of families who chose to go in person, knowing full well that they will be going remote, and they just wanted their kids to be in school for as long as possible. So it's not, I don't think that many families have an expectation that this is going to be a long-term plan. So just wanted to note.
Okay, so I think, Gretchen?
Yeah, I also wanted to add on to what Lori just said, in that initially families were told that if you choose in person, you can always switch to virtual. But if you choose virtual, you cannot switch to in person. And so I I have also been contacted by a lot of families who realized that by choosing in person, they would have options, and by choosing virtual, they would not have options. And so chose that for that reason, just to be able to make a choice later, because they were not comfortable in making that choice at the time. And so I do, as Lori said, wonder about that 70%, just in terms of the feedback that I've gotten from the community.
Okay. Any other comments? And then I want to kind of just ask a question in terms of how we want to move forward here. Yes, Dan.
Yeah, Amber, I just want to maybe suggest that the model that you and Amy are proposing, which we're working from and we need to evaluate, is one that I think it would reflect, and I would think it should be an expression of the assistance we're getting from the epidemiologists. So I think Masha can advise us about this and help us, in a sense, evaluate this formulation and this approach to the risk for infection, and maybe anticipating a curve before there is one, or not, or as opposed to relying on symptomatic expressions of the disease, or even if delayed by some of the test providers in town, relying on those some way a look at the ways in which those pieces will interact, and getting to a decision model that would work. It might be a two-week delay leading into a 2 or 3 week remote experience, but it might not. So I'd like to see what Maciek would say about this in terms of if he were to model it, how we would model.
Thanks, Dan. I think really mainly what I was asking to do is to evaluate the idea, not necessarily saying, I think this is what we really must do or the best approach, but to vet it out, the pros and cons.
Yeah. Okay. Thank you.
Okay. Any other questions? So I think the question I had raised in terms of trying to get some feedback from faculty and staff members is one that I think we need to, obviously we need to work in majorities in terms of how we proceed on any of these kinds of questions. So I'm not sure if we want to try to provide some feedback on that tonight, or revisiting that on Thursday. But I'm open to your thoughts on how to proceed with that, or whether to proceed with that. Dan. Oh, you're on mute, Dan.
I think the staff's involved with the town hall with the safety team. Is that true?
Mm-hmm.
Coming up this week?
On Thursday.
Like an opportunity to solicit some feedback from them. But the problem with leadership is that, and if this emergency in which we will continue to find ourselves living for months to come, if not longer, requires leadership. And we have it, as Amy was saying earlier, we have a total absence of leadership at the national level. And we have a governor who's making every attempt to inject some leadership into this situation. And in spite of that, a significant number of individuals in the state are throwing up roadblocks and using politics at potentially the expense of people's lives. But the person who is in the crosshairs for all this politically is Governor Wolf. And in the same kind of way, sometimes at our level, we may have to exert some leadership and ask people to in a sense, trust the data, trust the research we've done, and as long as we're transparent in terms of events as they unfold, to the extent that people know that what the rate of infection should it emerge, what it looks like, and what our cut points are. I don't know. I think that may be what people need right now is some sense of our confidence in the plan we're offering, and also our confidence in the data that we're going to propose that we follow in terms of making decisions going forward. And so that's my take on it. I think that in terms of working with the staff, they may have to just sort of go with it, and they are, as Scott was saying earlier, they're essential workers in our community. And if we have developed a plan that is as rigorous and as conservative as it is, and they're committed to supporting it, then and we're transparent about the outcomes as they emerge, I don't know if we can do much better than that.
Laurel?
Yeah, to the point you were making about what we might want to know, and I agree that just simply sending out a survey or not is not really effective. It might give the impression we're promising we something we can't deliver. What I would like to know, what would be helpful to know, is if we could get a sense in the town meeting, maybe where, even though it's about the health and safety plan, maybe we need another one or need to expand that, because what I'm curious about, I don't think we can ignore the vote that we heard about that was 89% of elementary school teachers and 79% of secondary saying, as I understood it.
That was 190 faculty members, I believe.
Well, so that's very helpful information to have. And that's my point. We can't ignore it, but we need to understand it better. We need to understand what the question was, and ideally then what it is that is the sticking point. Is it the health and safety piece? Is it the educational piece? What would make people feel that they could go, or that they thought it was a good idea to? So I'm not sure how to get that information, but I think that's what I'm looking for, is to better understand what the concerns were and what, if anything, and it may be that there's nothing we can do, but what we might be able to do. And it may be the idea that you had about the pause that would help people. I think several of us have shared ideas, and there may be other, ones that come forward in the next couple of days, but that's what would be helpful to me, is to better understand what, first of all, thank you, Dr. O'Donnell, for clarifying the number. That's very helpful. But what it was in their minds when they cast the vote they did.
Yeah, I would defer to Shay on that. I wasn't in the conversation. Yeah. I think it did come about just after the change in the K-5 planning, but I wasn't involved.
Gretchen?
Yeah, just because it's 11 o'clock now, I'm wondering if maybe it would be a good idea to continue this processing this on Thursday. Just because I know, at least for those of us who normally go to bed earlier than this, it's hard to keep up. So that's just my suggestion, is that we sort of cease this for now and continue later.
Sure. Okay, so we'll revisit some of these issues or questions, and we'll have, I think Maciek will be able to talk with us on Thursday as well. So, okay, I gotta click back to the tab with the agenda. Okay, so we had board committee meeting reports. Does anybody have a board committee meeting they need to report from? Okay. Upcoming committee meetings, the Finance Committee on Thursday has been converted into a board work session at 11:45, and then we'll have a regular meeting on August 17th. And we did promise at the beginning of the meeting that we would have public comment again at the end. I see one person has their hand raised. Michelle, if you would like to make a comment and of up to 3 minutes. And if you could unmute yourself and then just introduce yourself.
Hi, sorry about that. I wasn't sure we were gonna do public comments, so I went to a different part of my house, but let me, I have notes, thanks. Okay, so yeah, listening to this very long meeting, and thanks again for all of that information in all your work, I do continue to feel that if we can't give teachers choice, what does that tell us about our ability to carry out our plan? So kind of thinking like, let's not look at reality selectively, but the full reality, which does include what teachers want. So, I'm concerned, like, obviously for teachers' health, what are we teaching our kids? It force teachers back. What does that tell them about how we treat women? I'm also worried about economically vulnerable families. They're also the most vulnerable to the ravages of COVID. So how can we accommodate them, in a way that's safe and sustainable? I am worried about mental health, both for going back and not. And maybe there's some resources, if not spent, on one thing, if we were to go remote sooner, maybe they could be spent on, more mental health counseling. Finally, I'd say the sooner we can conclude community spread, we could get a break and go back. Wouldn't we like to get to that sooner rather than add to the spread by opening maybe when we're really not ready? So those are my comments. Thank you very much.
Okay, thank you, Michelle. Denise?
Hi, yes, Denise Cameron again, Ferguson Township. Just a couple things. So I'm a kindergarten para at Ferguson Elementary, and I won't speak for anybody else, just for me personally. I'm prepared to do whatever, but the thing is, we have like a million questions, all the little things. And I think that's the problem. It's like, there's all these questions that we don't know and we don't have the answers for, and maybe those are coming. But I know personally, that's maybe where a little bit of the angst is for me. It's just, well, how are we going to do this? And I think that'll come, but there are a lot of still questions that have yet to be answered. Now, speaking on the parent side, I'm concerned because we've known that Penn State students were coming. They released that plan in June. My son's one of those. He'll be moving into the dorm rooms. All of his classes are remote. They've been told that they'll stay in their dorms for the first couple of weeks. His roommate's a kid from Jersey, and he has to be tested and then stay in his room. So there are a lot of rules and things going on, but we've known that they were coming. And I understand, and I hear that there's this question about testing response, but we are like 15 days from the first day of school. And I think it's the fact that we don't, still know for sure. And it's a lot of investment for 2 weeks to say, gee, now we're all going to go remote. I think for parents, it's going to be a mad dash and scramble, especially for those parents who have to work. And regardless of the age of the kids, again, it's that alone time and that downtime. And the only other thing I want to say to that is, if we do go completely remote, I would just ask that there be some thought then put into these extracurricular activities, and how can we at least have something there to give these kids some of that social context. That's all I have. Thank you.
Thank you, Denise. Okay. All right, so with that, I'll be looking for a motion to adjourn.
Brant, so moved.
Denise,
second.
Okay, that's been moved and seconded. All in favor of adjourning, say aye.
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 Anyone opposed? Okay, then we are adjourned.